but we already have 100, almost 110 people on, so that's good.
I think we're on.
Says recording starts or
Start webinar.
it should say recording started.
I have to turn it on.
Okay.
Dr. Abdul Wahab has his hand up.
Oh, Dr. Abdul Wahab? Oh, we lost him. Okay.
He's here.
مرحبا كيفكم؟
كيفك شو اخبارك؟ Do you want to say
الحمد
something
لله.
now؟ في شيء ولا ايش؟ دكتور عبد الوهاب.
شو؟
Do you want to start now or do you have a question now or you want us to just start the regular webinar? في عندك سؤال؟
لا, just to start.
Okay. So hello everyone. We already started the webinar. Good morning, good afternoon, good evening to all of you wherever you are. Thank you for joining us for our weekly Doctors Against Genocide webinar. As usual, we have a great list of speakers who are talking on multiple areas of genocidal crimes all over the globe, unfortunately. In terms of priority, we think that the situation in Lebanon now is the most devastating. The bombing continues. The extension of the genocide and the ethnic cleansing campaign in the southern part of Lebanon is going unabated, despite the promise of ceasefires and stopping the wars that our politicians seem not to be able to keep. To get more updates on the situation of Lebanon, we are joined with Dr. Evelyn Hitti, who is the chairman of the emergency room at the American University of Beirut, to give us more updates on what happened in the last week, what you heard on the news about the catastrophic situation and the expansive bombing of children and civilians and hospitals in Lebanon the last week. Without any further delay, I'm going to give Dr. Evelyn the opportunity to give us updates. We did sign actually a memorandum of understanding between Doctors Against Genocide and the American University of Beirut last week. We are mobilizing funds to help the community there. DAG will be sponsoring free treatment and free care for injured people and displaced people who are coming to the American University of Beirut. We did start a fundraiser for this. Hopefully, Maisa and Karama will share the link in the chat soon. But we need your help. The people in Lebanon need your help. The hospitals there are either bombed or overwhelmed with the number of injuries and the casualties that they're receiving. As you all know, there is more than 1 million civilians who have been ethnically cleansed and displaced, and many of them continue to have a hard time finding a shelter or any access to care. So thank you, everyone. Thank you for joining us, and I'm going to give it to Dr. Evelyn. Are you with us, Dr. Evelyn? I know her connection is not the best, but if not, you froze, Evelyn.
Yes. Can you hear me okay?
Yes, we hear you now.
Can you hear me, Nidal?
Yes, we hear you now. It's good. Your camera is frozen, but we hear you.
Okay. And let me know. Okay, if it's camera, maybe I'll take the camera off. Is this... Hello?
Yes.
Don't get over here. Okay, you can hear me clearly, Nidal?
Yeah.
Okay, I'm gonna keep the camera off just for the connectivity. My connection isn't great. But I wanted to thank you all for inviting me back to give an update on the situation in Lebanon.
Okay.
This week was one of, in terms of Israel went on a mass airstrike of residential areas. Within 10 minutes, they targeted 100 buildings within Beirut and outside of Beirut, without any warning or the demolition orders that they usually give, which, as we know, in of themselves are not never sufficient for civilians to totally leave the areas. But this time, what was distinctive is that they didn't even bother to make the attempt to appear to have given evacuation orders. So as a result, what we witnessed was one of the largest number of casualties in a single day, or in 10 minutes, actually. The total death count so far is 300 dead and over 1,200 injured. And there are still people under the rubble, so that death count may go up. That day, I was in the emergency department when the strike happened. It was somewhere around after 2:00, and two of the big residential areas that were struck were actually within less than a kilometer from the hospital. So we heard the bombing, and then within a few minutes, started receiving the first casualties. The first victim and patient to come in by ambulance was actually a 4-year-old who was covered in dust and alone. Parents and many of the kids, the parents were not. Many of the kids were not accompanied by their parents, either because the parent was either killed or at least one or both parents were killed. But this child in particular came in alone, cloaked in dust and unable to open their eyes. And as we got closer to the child, it was apparent that basically the rubble and the debris had penetrated through the eyes, leaving him blind. And the rest of the day, or the rest of the couple hours that followed, were similar horrible casualties and injury event. And clearly, we ended up activating our mass casualty protocol, ended up seeing 76 patients by the end of the couple hours of activation. 6 arrived deceased, a third of those admitted, and 10%, 10 to 12% of the patients who were admitted were pediatrics. This to the August 4th activation. What was striking about this mass casualty event is just the high acuity of patients that we saw. Usually in mass casualties, especially blast injuries, 80% or 60 to 70% of your injuries are walk-in wounded. In this case, a third of our patients ended up getting admitted, so a much higher criticality rate than what we see. And that's because of the mechanism. It's because of the weaponry being used, and it's because of how that weaponry is being used. So you have 1,000-pound bombs being thrown at residential buildings where people and families are going about their normal life, and having contending with not just the blast injury, but also the secondary and tertiary impacts of blast injury related to the rubble and the debris falling. And this is exactly what we saw. We saw weaponized debris, whether it was in the eyes, in the eviscerated organs, in the abdomen, in the extremities, injuring vascular structures. And of course, for the well beyond that, in terms of the deceased, many of the bodies were just not recognizable as full bodies. And this is kind of what we saw that day and how that activation went. Since then, we continue to see the impact of the strikes of that day through delayed presentations. So I had a patient, I worked on Friday, and one of the first patients that I saw was a 19-year-old who'd been seen at another hospital on Wednesday when her building was struck, and she didn't recall how she was injured. She just recalls that she was pulled out of the rubble. And when she was pulled out, she was taken to the nearest hospital, sutured, had a brain CT that was read as negative, and was coming in with a worsening headache. And I couldn't even get the full history in the beginning. She kept on crying. And it turned out that she was crying not just from the pain, but from recalling that her brother had died in the attack. Her nephew and her niece had both been killed as well that day. We ended up re-imaging her, and she had a subdural, so we had delayed presentation. And in addition to that, with all the rubble, this is 2 days out, and rubble was in the lacerations, in the wounds were infected. So seeing, the impact of the very heavy load that hospitals were faced with that day, and temporizing care that also doesn't end on that first encounter, but ends up having complications afterwards. The other thing that the other types of encounters that we've been seeing since are patients who had deferred their own care on Wednesday because they were dealing with family members who had more critical conditions. One of the children that we saw on Wednesday was an infant who came in with a large. The mother was killed in the strike. And he was admitted to the hospital, and the only family member that was surviving was the father. So the father came in on Friday as well, 2 days after the initial injury, and he came in unable to hear and with abdominal pain, and from the crush injury that he had sustained. He ended up having some slow abdominal bleeding that ended up needing conservative therapy. But of course, the barrow trauma to the ear, and again, the debris everywhere, including debris in the ear canal that had to be taken out. So what I'm trying to say is that the injuries the counts of the injuries that we have from that Wednesday are going to continue to increase, because there are people who ended up having to delay presentations because they were dealing with family members who had higher and more urgent needs, and also the complications that we're going to see from those initial encounters. So the other thing that I just want to talk about briefly is that, Wednesday was unprecedented in the number of strikes within a short period, but it was no different than what we've been experiencing over the past month. The South continues, in the past couple of days, has continued to experience heavy strikes. The phenomenon and the weaponry that's being used has been similar to what was been used on Wednesday. The minimal notice to people versus or no notice to people living in residential buildings that are being struck is a phenomenon that we've been seeing from the beginning of the war. So it's not just the type of weaponry, but it's also how it's being used on civilian infrastructure. And I think the biggest reflection of how that ends up what the outcomes in terms of health are, is certainly the number of casualties, the scale of the casualties when you're hitting family residential buildings that people live in, but also the types of injuries. So in terms of scale, we're at almost, I think, 5,000 injured now, over 1,000 dead from the beginning of the war, with the counts with Wednesday now gone up to probably like around 1,500. So that's in terms of scale, but then the injury types is what I also want to talk about, because again, Israel is using weapons that are manufactured and made for army combat, and they are being used on civilian infrastructure. And what that means is that you have a high proportion of civilian casualties. And one main metric that we think about and we look at as a reflection of that usage of weaponry and civilian infrastructure is the percentage of patients who are pediatric who are injured. If you compare to the Russia-Ukraine war, in Ukraine, less than 1% of casualties are children. In Gaza, 30% of the over 70,000 killed are children, and in Lebanon, so far 14% of our casualties, where it's less than 1%, and also a reflect.
Dr. Hetti, can you repeat this, please? You broke up for a minute, but this is important to share, please. Can you repeat this? I think we have a problem with the connection. Do you hear me?
So one metric, yes, I can hear you. Can you hear me?
Yeah, can you repeat this part about the children, please? We did not get it. The percent or ratio of children
Sure.
in Gaza and Lebanon
Yes.
versus
So
Ukraine,
yes, the metric
places.
that we look at, yeah, the metric that we look at to see how discriminatory a war is being conducted in terms of safeguarding civilians is the percentage of children killed in the conflict. And if you look at the Ukraine-Russia conflict or war, less than 1% of Ukrainian casualties are children. Were you able to hear that?
Yeah. Yes, we got
Compare
that
to Gaza, where 30% of the fatalities are children. And in Lebanon so far, 14% of the casualties are children. So this is using some of the most, what Israel boasts about, using some of the most precision, targeted weaponry and technology, that it can basically call someone, tell them we're going to kill you, ask them to leave the home, and then chase them in their car and strike them and murder them. So you have that level of precision with its weaponry. And at the same time, you have this amount of mass civilian casualty. So you cannot have both that precision and that amount of civilian casualty and attribute the civilian casualties to being glitches or errors. It is clear that the civilian casualties are a strategy. It is a decision, and it is a strategy of the military, of the way that Israel is conducting its military strikes to achieve this number of children killed and civilians killed when it does have so much precision technology and weaponry. And beyond just the number and the scale of civilian casualties, you have to remember and think about the types of injuries that we're seeing. So when these bombs, these 1,000-pound bombs are being targeting residential buildings, the types of injuries are devastating, especially for pediatrics, and especially in a segment of the population where you have very little literature guiding physicians on how you care for blast injury in pediatric patients at this scale. And the structure to care for these type of patients doesn't exist anywhere in the world, because this is truly a unique phenomenon caused by the way that Israel is conducting its war. This epidemic of pediatric war-injured children is an epidemic that exists nowhere except in Gaza and now in Lebanon. So, and how are we seeing it? We're seeing it in one of the largest TBI, traumatic brain injury cohorts in children. So in the first escalation of 2024, we ended with 1,400 injured children. And out of those, we had 110 head injuries. So head injuries, and we're talking about seizures, we're talking about learning disabilities, we're talking about all the cognitive delays that are that families have to struggle with related to the head injuries in these children. We're seeing other phenomenon that we're seeing is, of course, lots of orthopedic injuries, but these are orthopedic injuries in kids who are still growing. So what that means is that it's not a single or one or two surgeries that they need, and then they can put this behind them. These are kids who are growing and need repeat surgeries to accommodate for growth and to change and update the prosthesis. So again, subjecting the children to multiple surgeries through, but even from when they get injured to adulthood, So strain on the children, strain on the families, and strain on the healthcare system. The third unique phenomenon that we're seeing is MDR, so multi-drug resistant organisms, Acinetobacter specifically. And what our infectious disease doctors are pointing out is that they are pulling the strain of bacteria from the wounds on arrival of patients to our hospitals. So these patients are within 24 hours, you swab their wounds, and we're seeing Acinetobacter. Very different from what the Ukraine experiences, where Acinetobacter and MDRs happen after prolonged hospitalizations. And what our microbiologists believe is that it's the type of heavy metals that are being used in the artillery and the bombs that are being dropped on these civilians that is predisposing wounds to the MDRs that we're seeing. So this is something that our infectious disease and microbiologists are looking at and investigating more, but this is definitely a phenomenon that we are facing. And of course, it does create significant challenges in the care of these patients. Both from the predisposition to difficult infections, but also infection control in the hospital at large. And finally, a phenomenon that is no different from what the children of Gaza were facing, which is orphaned children. This is of the 7 or 8 patients that we saw on Wednesday. As I mentioned before, it was either one or both of their parents that had been killed. And one of the children that came in, he was a 7-year-old. I usually do triage in mass casualty, and I just remember him sitting up, shell shocked, and with no one by his side. And it just reminded me of the images of the children that we were seeing from Gaza, having experienced the same type of trauma with no one, with their loved ones and their parents not there to help them and support them through it. So these are really some initial reflections from this week, and this is ongoing. I mean, certainly Wednesday was a tough day because it spanned across all of Lebanon, and it was concentrated in terms of time, but is no different from what the South continues to experience day in, day out. There were large targets and large strikes on southern Lebanon in the past couple of days with hundreds of casualties on a daily basis. So through this, our medical teams are continuing to work to the extent that they can to handle all the casualties that we're seeing and care for the displaced, and we will continue to do so. And the outcome, I think, in terms of our ability to sustain this and survive this is not going to change with the prolongation of this war. What will change is that certainly more people are going to suffer, and Israel is just increasing its record of war crimes that hopefully we will all find a way to make sure that there is accountability for down the line. Thank you.
Thank you, Dr. Hitti. May God protect you, and thank you for all the hard work you are doing in Lebanon. I don't think any healthcare system should be subjected to this or should be faced to deal with this. As you mentioned, this is a war and a genocide on life, and this is a war on childhood. As you mentioned, in regular conflicts, the percentage of children casualties is usually 1% or even less, as is the case in Ukraine and many other conflicts. While in Gaza, the percentage of children casualties is 30%, 30. 1/3 of all the casualties are children, and this is being committed by a country that has the most precise, the most sophisticated army, using all the AI technology and the most advanced weapons in the world. So you'd expect the ratio to be less than 1% in Ukraine. But in this case, it is 30%. The only explanation for this is that this is intentional. It's not an accident. This is intentional. In Lebanon, as you mentioned, Dr. Hitti, the percentage of children casualties is already at 14%, which also is not accidental, cannot be explained other than this is part of the genocidal campaign. This is not an accidental or this is not a a random result of these wars or these casualties. So thank you, Dr. Evelyn. I think Dr. Adla, do you have any feedback or anyone has any questions for Dr. Evelyn while she's here with us? Adla, anyone has any questions for Adla? Do you have any comments
No,
on
just
what
to say it's so
Evelyn?
good to see my friend, and I'm so proud of her. And it's really hard.
It
We
is
worry for
hard.
your
Stay
safety, we
strong.
worry for the people's safety. وش اديها لك؟
الله يخليكم.
Adla and Evelyn are longtime friends, and it's very expected to be very emotional, knowing that her friends and her people are going through this, and we are all here to support our colleagues and our people in Lebanon who committed no crime other than just being there in their hospitals, in their land, being subjected to the most brutal, most genocidal army in the world, supported by the most powerful country in history, and they all bent on destruction of life. And they have been doing this for the last century, only to exploit the whole region and put the whole world at risk now to make profit and to advance their anti-human illegal projects. So anyone has any questions for Dr. Evelyn? And again, we are starting a program of supporting our colleagues in Lebanon, starting with Dr. Evelyn. She's running the emergency room. She's going to be in charge of that program. She's already in charge of the program. Please support us, support DAG. We started a special fundraiser for this to help the hospital, the American University of Beirut, to cope with the number of casualties that they're receiving from direct injuries and also from the more than 1 million people who have been displaced from the south of Lebanon, and most of them have no access to care other than going to emergency rooms in Beirut and in the north of Lebanon. So any help you can provide is great. We can share the link in the chat later on, the fundraiser for Lebanon.
I'll share
The
it.
fundraiser also includes another arm, which is to provide food and food parcels for the displaced communities. We're going to do this in coordination with Life for Relief organization. This is also a United States-based organization. Unfortunately, as a new organization, DAG, we don't have an actual presence in Lebanon, and the need is urgent. We cannot wait until we do all the logistics there. That's why we are collaborating and coordinating with the organization that already have presence on the ground, including the AUB, American University of Beirut, and including Life for Relief, who will be providing food and aid to the displaced community. Any help is appreciated. We already shared the link in the chat. Please help the people of Lebanon who are being killed and massacred and displaced using our tax money. And that's also another reminder that we as doctors and healthcare workers can be more effective if we stop wars, if we prevent genocides. This month is the International Month of the Awareness and the Prevention of the Crime of Genocide. We need to pressure our politicians to stop these wars, stop this genocide, hold the perpetrators accountable. Please join us for April 15th, which is coming this Wednesday, to DC, to advocate for that. If we can stop one war, one genocide, we can save more lives than what we can do at the bedside. Now we're going to go to our next speaker, Dr. Salman Khan, who's a colleague who just came back from Gaza. He's an infectious disease specialist here in New York. Dr. Salman, thank you for joining us. Thank you for your sacrifice. Thank you for your witness. Thank you for being a role model, speaking for all of us. Thank you for upholding the true meaning and the true core of medicine and of being a doctor, that you will go, you'll try to help whenever you think your help is needed, despite all the risks. So, Dr. Salman, it's all yours.
Thank you so much for the introduction, and thank you for having me here. It's an honor to be back with DAG. It's an honor to be in Gaza. I just got back a little over 3 weeks ago, and we were there on a 3 week medical mission. And mainly, so my role there, so I'm an infectious disease physician. So part of the role was just doing ID consults at Nasser Hospital, sort of working with the internal medicine team. And then also a second role, which was beyond just direct patient care, was working with the infection prevention and control team and sort of looking at some of these issues like outbreaks and outbreak prevention and management, hand hygiene, some of the points that Dr. Hitti talked about in Lebanon around antimicrobial and multi-drug resistant bacteria. This actually is a regional crisis in the Levant. So I saw this in Syria in December. It's existing in the West Bank, and of course, it's also dire in Gaza. So I'll hope to share some of that. And I think we talked, maybe it was like late February. I think this was like our first week in Gaza where we did the webinar with Dr. Al-Farra. What I can do actually, so I wrote a blog actually about just this experience, and I'll share it here in the chat for people to read later and to share later, inshallah. And what inspired this actually, before we left Gaza, we actually met with Dr. Yusuf Abu al-Rish, who is the Deputy Minister of Health for all of Palestine, just like a remarkable human being. And his ask to us was basically, your mission is not ending now, it is just beginning, and to please share our stories. So that's what I tried to do with this blog, is to share some of the truths and the stories of the patients and of the courageous healthcare workers in Gaza. And if it's okay, I can maybe even just share my screen. And of course, we won't have time to go through like the entire thing, but maybe just like select parts and some pictures, and we can talk about both some of the ID clinical cases, some of the direct patient care cases, and then also some of these larger themes around infection prevention and control, antimicrobial resistance, and antimicrobial stewardship. So, okay. And okay, I hope everyone can see my screen.
Yes, we see it.
Okay, great. So yeah, I won't read verbatim, but just to give you like an idea of like some of the cases. This was when I was on the women's medical ward, which is an internal medicine ward at Nasser Hospital. So many of the patients we saw were elderly women, and so I think just one sort of theme, or one important point, things that, like, for example, they're seeing in Lebanon right now with these mass casualties and these mass traumas. That in Gaza is not like to the scale that it was before, but what we are seeing a lot of are just people who've had chronic medical conditions that have gone untreated, that have progressed. We're seeing patients with infections, and we're seeing a lot of elderly people, actually a lot of elderly patients who are coming in with sickness. So one case that I saw was this elderly woman. She was coming in with a fever and confusion. The suspicion was, she had a UTI, which is like a very common diagnosis. But despite this fact, she was not getting better on empiric antibiotics. And then actually the hospitalist I was rounding with, the Gazan doctor, actually was like, well, maybe there's something else going on. She's altered mental status, and this could be meningitis. And in fact, that is what the diagnosis was. And I was very impressed by just how quickly that the team came together and how efficiently they performed the lumbar puncture. They confirmed the diagnosis. So that was just very impressive. There was another patient who'd had aortic valve surgery in the preceding months, had an aortic valve replacement, and she was coming in with a fever. And then our suspicion was of prosthetic valve endocarditis. So we recommended doing an echo and blood cultures. I'll talk a little bit more in the subsequent slides just about some of the challenges with obtaining cultures and doing labs. I think yeah, I'll just forward here. So just to go to like a little bit about my work with the infection prevention and control team. So abbreviated IPC. So this is just something a team that's faced extraordinary challenges since the Israeli assaults at the hospital and the surrounding communities. Because during the peak of the siege, the hospital really was overwhelmed with civilian casualties. And I know we've seen those scenes on this webinar actually, and also live streamed of just like the hospital floor and the emergency floor being covered in patients and blood and bodily fluids and wounds. And this just makes the task of doing infection prevention and control so challenging, because just the things that we take for granted in Western hospitals, hand hygiene, hand sanitizer is a scarce resource. Clean water is a scarce resource. Being able to sterilize medical equipment, being able to do proper wound care. These were all things that were severely limited. And as far as PPE, this was also something that was very, very limited. And so, we have something called contact precautions or isolation precautions in the States. And the goal of this is to prevent transmission of certain contagious bacteria from patients from the patients to the healthcare worker, or from healthcare workers to other healthcare workers, patients to patients. And so this is just like a resource that was very, very limited. So this is signage that's provided by the WHO. That's posted in Nasser around putting on and taking off PPE. But the more proximate issue is that there's a major shortage of PPE. So we really need to, lift the siege and get these supplies in. Just jumping back to a clinical case. So this was not a case that I was directly involved in, but actually one of my colleagues who was volunteering there, who was a nurse anesthetist, told me that he actually was in an OR in the case. And this patient had a flesh-eating mold infection called mucormycosis. This is a diabetic patient. So diabetic patients are at increased risk of this, basically because you need to have an intact immune system. Specifically, you have to have intact neutrophils to control this infection. And so this particular patient developed a dreaded infection called rhinocerebral mucor, and actually was started off as a sinus infection, started eroding into his eyeball. The patient actually had to have enucleation, which is removal of the eyeball. And these molds, so these are usually found in the soil, but when you do things like mass bombardments, when you do demolition events, when you aerosolize, you can aerosolize these molds. Patients can inhale them. They can enter to the sinuses. You can actually have direct inoculation in the skin as well, from shrapnel, for example. And this can spread to other parts of the body. So this patient needed a major surgery and a major disfiguring, life-changing surgery requiring removal of their eye. The other issue, though, was that the first-line antifungal treatment for this infection is it's an agent called amphotericin. This is an essential medication. This is something that actually, from a global health perspective, really needs to be prioritized. It's used for things like cryptococcal meningitis. It's used for mucor. In Gaza, the supply of this, along with other antibiotics, was very sporadic. And so we were not even certain that this patient, patients have to be on this treatment for weeks and weeks at a time. And so if this patient's treatment with amphotericin is either going to be unavailable or interrupted, there's a serious chance that this infection is going to relapse, the infection is going to progress, and it can spread to the brain. And at that point, it really is too late. So just, another common entity that I saw on the women's wards. Again, a lot of these patients were elderly. Some of these patients were bedbound. If they're lucky enough to even have a bed, a lot of these patients, they have been rendered homeless. They have been displaced multiple times. They are living in tents in horrific conditions, sleeping on hard ground that gets saturated with water, flooded with water if it rains and it floods. And so these patients, have pressure ulcers, and they can have pressure ulcers of the sacrum, of the hips. And this is a very challenging entity. It's a common entity. We see this in our nursing home patient population here in the United States. We see this in patients who are not able to offload their pressure effectively. This requires multidisciplinary care. You have to have nursing care, you have to have special equipment and beds and physical therapy and surgery. And so that's in a resource-rich setting. So in a resource limited setting where resources have been actively taken away, this is just like incredibly challenging to manage. And these infections, these ulcers get inevitably infected. They require extensive debridement. So I'm just sort of proceeding along here. This was just we went to Gaza City actually for an iftar one evening. This was during Ramadan. This was like a beautiful sunset that we saw. But this is what the skyline looks like. This is a horizon in Gaza City, so you can see the destruction that's omnipresent in the tents and the back in the buildings in the background, and then you can see the tents here as well. These were some dear children that we encountered along the way who came up to us, and some of these children are orphans, and it's a horrific crisis. Just like what we're seeing playing out in Lebanon right now is the direct targeting of children and families and the disproportionate impact that has. That these children, many of them are growing up without parents, and it's just heartbreaking. So this is just our PEMA team in Gaza City. Again, some of the destruction that we're seeing. So I will, I can talk a little bit more just about what we saw in the intensive care unit in our rounds with the infection prevention and control team. So we found, this speaks to the antimicrobial resistance problem. So there were actually 4 cases of ventilator-associated pneumonia in the ICU, and these were all due to a very resistant bacteria called CRE. And so this is a carbapenem-resistant Enterobacterales. And effective treatments, even in resource-rich settings, the treatment options for this are very finite. So in Gaza, the treatments are virtually non-existent for this. And so in ID, we refer to this as a drug-bug mismatch, where the patient is getting some antibiotic, but the bacteria is resistant to that agent. So it's unlikely that the agent is going to be effective. And then just coming to the microbiology lab. So we did visit the microbiology lab, and everyone here who has exposure to working in a hospital knows how essential the micro lab is for getting cultures for patients, getting diagnostics done in a timely basis, figuring out which antibiotics are the best. And so what the lab was able to tell us with these CRE cultures was that all of them actually had the same antibiotic susceptibility pattern. So, we didn't, of course, have access to some of the more advanced technologies like whole genome sequencing, but we could sort of conjecture that these were all related. These were all the similar strain or the same strain of bacteria. So this was a potential outbreak that was happening in the ICU. And so some of the issues we identified, hand hygiene, it's already something that's limited. Soap and water was available, but it could be more available. Hand sanitizer is something that is triaged. It's a precious resource. So even what we see is when the rounds are happening and you have an entire team that's rounding, it really only is the attending physician who is physically examining the patient, because they're the only ones who, they have to ration the hand sanitizer. So we recommended, just more adherence to hand hygiene and trying to, and these were signage that was posted as well. And, just trying to cohort the patients because we don't have protective equipment. So at least what you can do as a mitigating measure is move all of the infected patients to one side of the unit and try to avoid, sort of cross contamination to other patients. I have to give a shout out to the hospital janitor. So these are people, our custodial staff who are really unsung heroes. They don't really get credit. They're not considered glamorous like the doctors or the nurses, But these really are people who are making a major difference every day. And so this janitor was cleaning, disinfecting the surfaces and the equipment, likely breaking the chain of transmission of infections and probably preventing a lot of hospital-acquired infection events. And so, this just speaks to how important things like waste disposal, proper cleaning, just how important all of that is. So just anything else here? Yeah, this is just more signage that was posted. So this was just a gift from one of the doctors there. It's a prayer rug that she gave me, which is just like a very special gift. So I think I'll just I can talk briefly about the men's ward, and Dr. Nadal, please interrupt if I'm just like going on and on, but I can stop at any time.
Dr. Salman Khan, you can go on and on as much as you want. It's fine.
Okay, inshallah.
Very important, very important. This is a first account eyewitness, and these are facts that we all need to know, especially as a healthcare community, to see what our colleagues are dealing with there, despite lacking everything. So go ahead.
Thank you. So I'll just shift over to the men's ward now. So this is the men's internal medicine ward, and I really have to talk about the doctors I met there, and especially the residents and the interns, who were training. Just the circumstances that they've encountered. So this one intern who greeted me in the morning, young man in his 20s. He was in his first year of postgraduate medical training. Turns out he wasn't even a resident at Nasser Hospital. He actually started his residency at the European Hospital. Unfortunately, that hospital was destroyed and left completely, out of function. And so these residents were actually displaced to Nasser Medical Complex to continue their residency training. I thought back to, my intern year was in 2012 in New York City, and that's when Hurricane Sandy hit. I don't know if anyone here remembers that, who's from New York, but I was at Bellevue Hospital, and it was kind of a harrowing night. We lost power. We were running around, manually bagging patients. The National Guard came in. The hospital started flooding. Getting patients out, was just a huge challenge. And this was because of a natural disaster, a hurricane. I make the point that what the doctors, the residents in Gaza are dealing with is not a natural disaster. It's a very unnatural disaster. It's a man-made disaster. And their whole medical education has really been put on hold. But despite that, this resident, this intern is not complaining. He's just demonstrating so much maturity. And he's like, we're stronger. We have no other choice. We have to go on. A lot of the pathology that I saw on the men's ward, it really paralleled what I saw in the women's ward. There's just a very high burden of chronic disease, a lot of CKD, a lot of COPD. Other issue that we saw is accidental overdose and poisoning for medication. So this elderly patient came in with hypoglycemia, which was a little bit strange because that patient actually was not diabetic. And so we're like, well, why is his blood sugar so low? And the thought was that he's probably sharing some of his medication or other patients, because there's a shortage of medication. Patients are sharing pills with each other and not knowing, what exactly is this medication. So he probably accidentally took a sulfonylurea that caused an overdose. There was a case, actually a cluster of leptospirosis. This was actually the month before I came on, but this was what was endorsed to me by one of the medicine residents. And so leptospirosis, as many people here already know, this is a zoonotic infection. It's a bacteria that spreads from rodents to people. And, back in February, there was terrible heavy rainfall in Gaza. There was extensive flooding of tents. And so this resulted in exposure probably to rodent urine and feces that resulted in disease transmission. What I was actually really impressed by is just the clinical acumen of the doctors in Gaza, that all of these cases, these were diagnosed based on clinical presentation. So the patients presented with fever, they had jaundice because leptospirosis can cause liver failure. They had this classical finding of conjunctival suffusion, which is like a redness of the eye lining. And so this is how they established these diagnoses. It wasn't based on some fancy, expensive test, which we do way too much of in Western medicine, and sometimes getting, false positive results, sometimes seeing sometimes at the expense of the fundamentals of history taking and physical diagnosis. So I was just really impressed by their diagnosis. I won't say too much about this, but I myself got to personally experience, not from being a doctor, but from being a patient, some of the infectious disease burden, coming down with like what I presume was an infectious colitis, bloody diarrhea, probably from contaminated water. Even finding azithromycin, which would have been the first line antibiotic, I couldn't find it. And this is, maybe I should have thought ahead and prescribed some before the trip. But if a visiting volunteer doctor has trouble getting, and if an ID doctor has trouble getting an antibiotic, you can imagine what the situation would be maybe for a patient who doesn't have access to care, is not a healthcare worker themselves. Just other things, in terms of infection prevention and control, what are some of the subtle ways or the insidious ways in which the occupation is committing genocide against the people of Gaza? There's a sterilizing solution called ethylene oxide. This is a standard of care solution that is used, and it's used specifically for equipment like endoscopes, because these are heat sensitive equipment. They cannot be autoclaved because the heat is too high. So these are needed to sterilize equipment. Without proper sterilization, you actually can cause outbreaks, and this has been well documented, of outbreaks in the hospital of multi-drug resistant bacteria because of improperly sterilized equipment. And the occupation is just not allowing this solution, and so there's a major shortage, and so they're having to sort of have second line or have to take the risk of using this equipment without proper sterilization. So yeah, I mean, I can go on and on. This was like an apocalyptic sandstorm that we saw. Everything turned orange. What else? Yeah, and then just like, the sort of structural determinants, food is still an issue, a lot of overpriced food, a lot of highly processed food and junk food in the markets. We saw one watermelon cost $25. Like, that was just astounding to me. Like, who can afford that? And what else? Yeah, I mean, I think we talked a little bit about antimicrobial resistance, and this is just like a huge issue that has a lot of determinants. And we talked already. Dr. Hitti said already about some of the munitions that are being used and some of these explosives in the soil, some of these heavy metals. These can actually upregulate resistance genes and bacteria. So even in the community setting, we're seeing a large burden of resistant organisms. And then you take collapse of the healthcare system, overwhelming overcrowding, breakdown of hygiene and sanitation infrastructure, sporadic antibiotic supply. All of these conspire to facilitate the emergence of antimicrobial resistance. So yeah, I think I mean, this was just us visiting Al Shifa Hospital, which, they besieged multiple times and tried to destroy. And this is actually a mass grave at Al Shifa Hospital. And yeah, other than that, this is my dear colleague, Dr. Hamouda, who does infection control work at Nasser Hospital on the left. We went to the dialysis unit. There's a shortage of dialysis supplies. Patients, it's hard enough to get to dialysis. You have to, a lot of these patients who are on dialysis, they're not healthy patients. They're immobile. They have a hard time getting around. A lot of them are wheelchair bound. And there's also a shortage of nephrologists. Israel has murdered many doctors. And we all remember Dr. Hamam Allo. May he rest in power. And then the cancer patients, they're also facing really tough odds. A cancer diagnosis is often a death sentence in Gaza. Screening is often delayed. Treatment is often delayed. And we know that these patients have compromised immune systems. They're at increased risk for various infections. So yeah, I'll stop sharing here. I know this is a lot of lot of information, but if there's any questions or comments, thank you.
Yeah, thank you, Dr. Salman. As you mentioned, this is all man-made. This is intentional. This is not a natural disaster. And everything you mentioned is something that could have been prevented. It should not even have happened. And everything that continues to happen with the lack of access, lack of medication, lack of supplies for these doctors to deal with it is also intentional. It's not natural disaster. It's not that these things cannot be get into Gaza. These are all intentional acts of genocide by other means. So for those that they did not manage to kill with the bombs, with the fire jets, they want to kill them with starvation, with disease, with lack of access to medical care. So I mean the blog that you shared, that you made, is really very comprehensive. It's really I don't know. It can be used as an evidence against all these crimes that they have been committed, and this is coming from a professional testimony, eyewitness account, seeing all these abhorrent actions that continue to be done in our name. Anyone has any questions for Dr. Salman, please?
I have a question, brother.
Yes, Fadl Munder.
Thank you so much for coming to Gaza. And I want you to share your story, how you applied to, you have reached to Gaza, and you are an example, a very good example. So if possible, to share us your story of applying and the way that you came. Have you came with any organization, or you came by yourself? And the most important thing, have you used your original passport, or you use your citizen as you are a US citizen? So that is my question. I hope that will be motivation to many doctors to come to Gaza for treatment, to treat the people, the patients, as you already know how is the situation in Gaza. Go ahead, brother.
Thank you, Brother Muntar, for that question, and it was such an honor to be there. What I'll say, honestly, I've been trying to go to Gaza for the last 2 years, and it just didn't work out until now. And I believe God's timing, Allah's timing is perfect. And it ended up being, I think, maybe a more impactful time for me as an infectious disease doctor to go now, as opposed to 2 years ago. I feel like it could have been much less impactful what I could do, because I'm not a trauma surgeon or an ER doctor. I don't really do procedures and such. And so as far as applying, I mean, so I'm a US citizen, and the applying, was done through like various NGOs. So I'd applied before with Emma. I'd reached out to Humanity Auxilium, which I think is based in Canada, just with different groups. So this current mission, it actually ended up being, I had a contact within PAMA, and I saw that PAMA just sent like an email about, hey, we're doing a medical mission, and I'm like, hey, well, what about ID, or can I go in such and such time? It was going to be a 2-week medical mission, and I think that's for a lot of us doctors. So I know some people are like working per diem or part-time in their schedule, or they're semi-retired and their schedule is more flexible. But for most people, it's hard to take like extended period, like several weeks off at a time. So this was a 2-week mission, or was supposed to be a 2-week mission, ended up being 3 weeks because of the war that Israel started with Iran. But that's a different story. But yeah, so once I reached out to PAMA again, I just filled out the application again, and this time it actually worked out. You have to have, of course, some flexibility, because the dates may not be finalized. And then there's as you know already, COGAT, which is like the Israeli entity that allows people to come in and exit. They have to give the final approval. So there's also been cases where some of my colleagues have gotten all the way to Amman, but they're not allowed to cross. They find out the day before they're not allowed to cross. So I would say to people who are interested, yeah, just keep trying, and even if the first, second, third time doesn't work out, just keep trying and try different venues. And yeah, please, if anyone wants to reach out to me, privately in the future for any direct advice, you are welcome to. Thank you.
Thank you.
Thank
So,
you so
Dr.
much.
Dr. Salman, from what you mentioned, there is something called bug-drug mismatch. So, for those people who have these infections, whether in their amputated limbs or in their wounds, abdominal or chest, and they don't have the medication, the right antibiotic to treat them, these people are either losing their limbs or dying due to sepsis because of lack of medications and the right antibiotic. These are all preventable deaths. We have a question from John for you, Dr. John Rohr.
Yeah. Do we know collectively how many foreign doctors are allowed in per month into Gaza over the last 6 months, say? It seems like there's always some there, but I'd like to know numbers if I could, and what determines whether you can go or not.
Yeah, it's a good question. I can't give you numbers. I can just tell you for our mission. So everything like so there's various NGOs that go and people not just like from the US, but from around the world. Like we had British NGOs, Norwegian NGOs, Jordanian NGOs, and everything gets coordinated sort of centrally through the WHO. So like each of these NGOs, I think, has to submit the application, which includes like the passport and things like that, to the WHO, and then the WHO, I think coordinates with COGAD, and they're the ones who sort of make the final determination for who can come in and come out. And a lot of times it's arbitrary, like the reasons for denial. I think it's just to be cruel sometimes and to be difficult. I see Dr. Browner has a comment. Maybe you can.
Dr. Browner, you have a comment or a question? You were to Gaza yourself too.
Yes.
Go ahead.
Yeah, thank you. Thanks for your work, Salman. Something I find interesting is that, post ceasefire, the conditions are even worse now from an infectious disease standpoint than when I was there in June of 2025. Rationally, you would think that with, increasing with the post ceasefire, things would be in better shape, but it doesn't sound like it. I mean, I just find that to be absolutely absurd.
Yeah, I think that's accurate. And I think part of it is also just that a lot of these infectious sequelae, like they're delayed manifestations, some of these people, like Dr. Nadal was saying, some of these patients can develop a surgical site infection from a wound or trauma, and some of these can present acutely with sepsis. Other ones will become something like a chronic entity, like a chronic osteomyelitis that is inevitably going to shorten the patient's lifespan, but death may be delayed by weeks, by months, for example.
Yeah, absolutely. But even including hand sanitizer, when I was there, it was fairly copious, and now having to ration it to just providers making direct contact with the patient is pretty crazy. And I also had a really interesting case while I was there. I was in the trauma resuscitation room, and somebody kept tapping me on the shoulder. This older gentleman, and asking me to follow him, and I was a little bit reluctant due to the language barrier, et cetera, and I was much more effective in the trauma resuscitation room. But I ended up following them, and they had their son, who's probably in his 30s, had a wound in his groin 3 or 4 weeks before that, and it just kind of smoldering, and his vital signs were relatively stable, a little bit of tachycardia, but they just started him on another topical antibiotic because his acuity was fairly low based on the triage algorithm. And so I finally went and saw him, and sure enough, he had necrotizing fasciitis, and I was able to grab a surgeon, and they took him to surgery and did a 6-hour debridement just hours later, and ultimately walked out of the hospital there. But it's incredible the delayed effect of the pathology, and it is just an extraordinary place to work as a Western trained physician in a resource rich environment. And I'd like to say remember, this is a resource depleted environment. This is the standard of care for medicine there is extremely high, And it's another, just another form of violence, trauma, watching the system collapse.
Thank
Dr.
you.
Salman?
Yeah. Thank you, Dr. Bronner. It's I mean, the in Gaza has been rising to the occasion. There's always been a siege. There has always been difficulties in getting equipment, MRI machines, scans, chemotherapy, radiotherapy. Certainly, the equipment was never allowed to get into Gaza. And despite all this, the brilliant medical professionals in Gaza made do, and they were able to provide excellent healthcare to their patients. But right now, it's kind of like a dwindling supply of everything. And they still have to deal with create chronic problems that will not be easy to resolve. So we're very aware of it, and we will we have to keep pushing for open borders for Gaza. So thank you. Thank you, Salman. Nidal.
Yeah, thank you, Dr. Salman. Again, thank you for the important information, the testimony that you shared. Thank you for your sacrifice. We know that also you and your colleagues got stuck on the way out and you were not allowed to leave Gaza on time. There was more than about 10 days of delay for your departure because of the war that they started on Iran and Lebanon. But we are glad you are here. We're glad you are safe. We're proud of you. We're honored to have colleagues like you. I have other questions for you. Maybe later on we can talk about them. I think we need to hear more from you. What you shared is very impressive and very eye-opening. So far, for those who just joined us late, earlier we have Dr. Evelyn Hitti. She's a professor of emergency room from the American University of Beirut. She shared the situation in Lebanon. The number of casualties the hospitals are receiving there is huge. We, Doctors Against Genocide, signed a memorandum of understanding with AUB and with other organizations to support the patient care for the injured and the displaced people there, and also to provide aid and relief. Many of you have already donated to us, so thank you for everyone who already donated. For those who did not, please, the link is in the chat. There's a fundraiser for DAG to help our people and the community and the healthcare workers in Lebanon. Please try your best to donate and spread the word and to share the links with those who can help. We really appreciate you. All the work that we do is because we have great supporters like you. We could not have done any of this without you. So far for the last 2 years, we have been listening and hearing from mainly male doctors and healthcare workers and team members in Gaza, and they have all been very impressive. And I think it's because the people of Gaza are resilient and strong, and they love life, and they always find every way to survive. That's why they are surviving. I think if what Gaza have witnessed, what Gaza have went through, maybe has been done anywhere else, the whole society would collapse. So our male colleagues, doctors, healthcare workers have all been very impressive, and we are proud of them, and they have been our inspiration and role model. But don't make the final judgment yet. Wait until you hear from the women in Gaza. One of these women is Rasha Al-Awar. She's here with us, and I'm gonna just read her bio. This is not a bio that's coming from LA or from Los Angeles or from New York. This is a bio coming from someone who's been witnessing genocide for the last 2+ years and been under siege for more than a decade, 2 decades. So Rasha Al-Awar, she's the executive director and digital marketing strategist and social entrepreneur. She's a visionary entrepreneur and management expert with over a decade of experience driving digital transformation and organizational growth. Again, you are hearing this from Gaza, not from LA. With a foundational bachelor degree in mathematics from Al-Aqsa University and a master degree in management from the Islamic University. Again, these are universities in Gaza. No Harvard, no Johns Hopkins. These are from Gaza. Russia uniquely combines analytical precision with high-level strategic leadership. High level, imagine you being in the genocide for 2 years and you're still talking in this way. High-level strategic leadership. Starting her career in 2013 as a content manager and writer, Russia quickly established herself as a leader in the e-marketing sector. In 2019, she co-founded Creativity, a full-service digital agency that she scaled from a small startup into a powerhouse of 55 permanent employees by 2023. 2023. That's just before the genocide started. Under her leadership, the agency delivered specialized services in content management, sponsored advertising, and media production, while incubating 3 emerging sub-projects. Russia is a specialist in navigating complex environments, as if it can get any more complex than being and living through a genocide, to create professional opportunities, not just for her, for others. Her recent initiatives include, number 1, Vibe Hub, state-of-the-art co-working space designed to provide infrastructure and high-speed connectivity for freelancers and students. Number 2, Return to Work Initiative, a strategic project launched in 2025 to help remote professionals resume their careers and reintegrate into the global digital economy. Currently, expanding her business operations across the Gulf region, Russia remains dedicated to building bridges between technology and human potential. She is a passionate advocate for remote work infrastructure, professional networking, and the development of sustainable digital brands. We're proud to have Russia with us and to hear from Russia, and we are proud to say that Russia has been one of the best problem solvers for DAG. Without Russia, more than half of our projects in Gaza would not have been implemented. So for that, we are really thankful, Russia, and thank you. It's all yours. Go ahead and it's all yours, Russia.
Thanks, Nidal. Good evening for everyone. I'm Rasha Alawa. I'm the CEO of Creativity Agency, and I'm 38 years old and a mom for 5 kids. And unfortunately, because this genocide, my husband believed Gaza before this genocide, and I faced this genocide with my kids only. Okay. Today I will tell you about the project Back to Work. Firstly, I will share with you a small presentation about this project. Okay. And I will explain a lot of this. Firstly, at Creativity, we believe that investing in digital talent is the fastest way to restore the digital economy and strengthen the resilience of our creative community. Today, we are proud to announce the official commencement of ambitious initiative empowering Gaza's digital economy, the 6-month incubation program. Okay, firstly, I share the presentation here. And this visual project has been made possible through the support of Doctor Against Genocide, and we appreciate them. We extend our deepest gratitude to them for funding this initiative and providing these 50 professionals with the opportunity to recount their career. Their support ensures that these freelancers can support themselves and their families with dignity, creating a
Russia,
lasting.
did you share the presentation?
Yeah,
It's
in
not sharing
the
it. It's not
yeah,
sharing it. You want to share it, please?
Can you
Go
share
ahead,
the
Karama.
screen?
Share the
No,
screen so we
I'm
can.
not share screen. I'm share the presentation. Just
Would
a
you
minute.
like to share the presentation? Share it on the screen?
Yeah, just a minute.
Okay.
Yeah, share.
Yep.
This is, yeah.
Yep, it's working now.
Perfect.
Okay, just a minute. I think, yeah. Now, this
You
is
want to do it as a
about,
presentation mode, or it's already a
yeah,
presentation mode? Okay.
okay. This is about the presentation. So in the first one, we talk about creativity and how we establish our company. Then some about project background context. So I will resume. This is the impact of our project in ICT sectors and about what the conflict in 2023 and the impact of this project for the freelancers. Okay, what we can provide them these freelancers. Firstly, I will explain about the project we started on March 28, and we witnessed an incredible drive for professional recovery. Within just 2 days, we received over 150 applications from freelancers eager to recount their professionals. We select top 50 freelancers following a rigorous evaluation process based on digital proficiency, and we have selected them to begin their 6-month incubation journey. This professional present what we can provide them. The participants will now operate, just a minute, what the challenge that faces for freelancers in Gaza. They have issues in good internet, and they face a lot of issues in electricity. So we can provide our selected participants a lot of, firstly, professional and safe environment. Second one, high speed connectivity, uninterrupted internet access to maintain global competitiveness. Third one, the power, continuous power, 24 hours per 7 days, alternative electricity to ensure zero downtime. So our clear objective. So this is about the project response, what we can provide them, about our goal in this project. This is about the beneficiary who will selected. So the main goal that we targeted, the freelancer will increase their income from $300 per month to $500 per month. Yeah, this is the strategic objectives. The first one is restore capacity, and the second one increase the monthly revenue for these freelancers, and the third one restore trust with international clients and prevent contract cancellations. So expected outcomes, we focus in increase the income injection approximately from we will can see about $150,000 per month to $25,000 per month. So this will be increasing for our injecting approximately. So this is about our project. and we started it in the last week. We have 50 freelancers now. They started in our hubs. I am now in the hub, in my hubs, Vibe hubs, and I can introduce it for you. محمود لو ناخد بس إضاءة المكان.
If you can stop sharing so we can see the hub where you are now. Okay.
Yeah, I returned to my work I haven't electricity in my home now. So I returned to my work to do this meeting. This is the open workspace here. Yeah, any of our freelancers can
Rasha, are you with Mundir?
Yeah, I returned to my work to do this meeting.
لا مش هان
مش
فكرتها
نفس
موجودة.
المكان.
لا في نفس الحارة, the same area but it's not the same hub. My hub
Okay.
name
Mundir, you have to go to
branch
Russia.
hub.
You have to go to Russia's hub.
أنا صرت أطلع في حالي. I become very confused actually.
Can you stop sharing the screen? Russia,
I
can you
haven't
stop sharing?
internet and
Stop
I
sharing the
haven't
screen.
electricity in my home.
Russia,
So أنا مجبرة إني أرجع.
Russia, can you stop sharing the screen so we can see where you are going? Stop sharing, please.
Okay, just a minute. Stop share.
أختي رشا أنا موجود في شارع الثورة. أنت وين؟
شارع الثورة. أنا عند كاظم فوق كاظم.
okay, almost the same. 10 minutes from here.
المرة الجاي بتيجي من عندي يا منذر بتعمل الميتينج.
خلاص ولا يهمك.
بالمناسبة هاي أصغر واحد في أولادي مرافقني اليوم.
مرحبا. كيفك؟ تعال خلينا نحكي معاه. تعال كيفك عمو؟ كيف حالك؟ شو اسمك؟
احكي لهم.
يوسف. كم عمرك يا يوسف؟
قديش عمرك يا ماما؟
6 سنين.
6 سنين.
احنا عطلنا امك، اخذنا امك عنك وشغلناها.
لا انا روحت على البيت اخذته ورجعت معاه. بالمناسبة هذا اصغر واحد فيهم، الكبير عندي بالجامعة.
ما شاء الله.
أنا صراحة I have visited the place. It was amazing place. The internet is very fast there. That is my witness.
So the project in summary, the project is Russia and Mariam, they're sisters. They are the one who run this company, created this company, and founded this company. Is providing an opportunity for 50 freelancers. Those 50 people who have no reliable access to internet and power and electricity and all these things, they will come to Russia. They will train them how to do international business and e-commerce and all these things. And they will provide them with 24/7 access to internet, high-speed internet and power and everything. The goal is to get more people to be able to provide for themselves, to make more income, to train them on new jobs, how to work, how to function remotely. So it is a business creating opportunity is going to help those freelancers and it's going to help their families. If we train 50 of them and give them access, they will be able to make enough income to support them, support their families. And every few months we get, more people. They interviewed a total of 150 people applied. They chose 50 of them. And the goal is for DAG to provide the expenses and the cost for their work at the Vibe Hub and the other hubs that Russia runs. They will provide part of the cost and DAG will provide another part. This way we encourage them to be more committed. And also the goal is to increase their income and their productivity. I don't know the percentage that Russia has in mind, but it's like we can double their productivity when we provide them with this access, constant access and reliable connectivity. Many of them actually, she already had some success story that because people who don't have reliable internet or power, they cannot find jobs overseas. But once the companies overseas know that this person actually does have reliable connectivity and they can commit to an 8-hour work or 4-hour work every day, many of them already got offers from international companies to work. Is this true, Rasha? A few people already had
Yeah.
they
Yeah,
found jobs, so they got hired because they have more access
yeah,
to
you
internet.
told about the main point about these freelancers. They face a lot of issues in electricity and internet, speed internet. They decrease their contract, international contract, so we can provide them more than hour with the good internet and good electricity, so they can have a lot of contracts per hour or per contracts with the international companies. We have a lot of expertise here in Gaza in e-marketing or in content or development or any service that can provide online as online project. So if we can provide them as place, we can get more revenue for their families. So we can help them in little, but we have a good goals, and we achieve these goals.
Monder, what do you think? You work in the same field. What do you think?
Yeah,
Offering the
actually,
freelancers, the new ones, this opportunity and this access, do you think it's going to have a good impact on them to give them more
absolutely, brother.
opportunity to work and create and provide for themselves and for their families? And where are you
Absolutely.
now? How does that work for you?
Almost the same. We are very near, 10 minutes from here, actually. I can just walk I've been there before because as a freelancers, we used to try many internet hubs and wherever electricity, wherever a good internet connection, we are gonna see there. The hub that I'm sitting at the moment, named Branch Hub. It was built 2 years ago, and I used to come here, and I live here actually. It is just also 2 minutes from Al-Shifa Hospital. So it is in Gaza, and the main reason why I came, as she just mentioned, Sister Rasha, that the electricity, they provide electricity and provide a good internet connection, and that's what we are looking for. And it's not only me; there are thousands of people are used to work in freelancing. Most people actually working in design, and we used actually in the same place they taking also training for the AI, the artificial intelligence, that's created a lot of jobs. And I already registered in one of these training courses. So that will be better for us to, as they mentioned, teach me how to fish. Don't give me just a fish. That's the main idea. That's what we are looking for, and by that way, we can teach as many as people, and that we can get income from outside Gaza. Actually, I did the same thing. For example, I never worked before. Before the genocide in a humanitarian aid. So that my work was only to sell and buy through online, through Amazon or eBay. And during the war, we started to find so many challenges. So coming to the hub, such as Sister Russia hubs, we can figure out solutions that can solve the problem. And by his experience, by the other people experience, we can create work, we can create job, and that is really amazing work. And all of the world must know what there is people in Gaza that they are intelligent, they have many skills, but without internet, without electricity, that hide this experience, and we can't work with. I really don't know exactly how to express that, but for me, I paid to sit here. But once if there is any sponsor outside Gaza that can sponsor this project, that will be the most important. That's a wonderful job, actually. And I really recommend this work actually.
How much do you
I
pay, Mother, if
want
you
to
don't mind me
add
asking?
something,
Actually,
Nidal.
I can ask the owner. He's still young. He's only around 32 years also. My bill for the last month, this is the bill actually, 400 new Israeli shekel, approximately 120 US dollar. He already give me like the bill, I can show you, for a month.
Yeah.
So that is, if you can pay for that, that will be amazing. Actually, I can go for free. I don't have
No,
to
we're not
pay.
going to pay for you, Mother. Not for you. We're paying for everyone except you.
No worries. This
بإمكانك
is the
تستفيد
bill
من المنحة
actually.
عنا يا منذر.
If I know, I will come immediately. I don't need to come here. I have tried your internet. It was amazing actually. They give me like a 20 mega internet. So that's really amazing service.
I want to add something for all. Not just freelancers can benefit from our workspace. There's a lot of students in universities. There's haven't electricity in their home, so they can move in their studies by download these lectures and study online study with there's universities here in our workspace. So we can provide this service for three peoples, the students and the universities and the freelancers, and the second one, the entrepreneurs. Some of the small entrepreneurs have small teams. They can get here and they can use the meeting rooms to connect with their teams.
صحيح. Actually, as I can see in this hub where I'm staying, where I'm sitting at the moment, many of them are software engineer. They are building, for example, the man that is just next to me, he is building a website for a customer in the Gulf. The second one, the girl that was next to me 1 hour ago, she is doing a lecture for students in Arabic countries or different countries. She's teaching a language, Arabic language, for a non-speaker language. So that is how looks like, and they are paying them through PayPal, or they are paying them through cryptocurrency or through Bank of Palestine IBAN. But this actually make me more headache, and that's make me pessimistic and collapse sometimes when I'm using our service. I'm talking about Bank of Palestine's, and that's because controlled by Israel. So, for example, you send me money for the last project, but I still not receive it yet, even for almost 10 or 12, 2 weeks. So that's the challenges that we are facing. But in the same time, once I came, for example, in this hub, we can create different ways, such as they are teaching us how to make an app or an account on cryptocurrencies, so we can sell and buy cryptocurrencies. Even we don't need to go to money changers. One of the guys who's working here, who's actually sitting here, he is transferring the cryptocurrencies to Bank of Palestine, and he can do the same thing actually for Bank of Palestine to crypto. So for the people who is doing trading, also that's a very good opportunity to sit here, even if it is not recommended, because we need to have like expert people. But in the same time, as I mentioned, that's really amazing work. I really recommend it. And that's actually the trending. Many hubs in Gaza is not her hubs or this hub. Actually, there are so many hubs coming so far, but the people who's going, they are the most important thing. For example, this hub will be open until 12 p.m. 12 a.m. Sorry. So that's why I came here during the night time. Many hubs, the difference between this hub and other hubs, that they close early because there is no electricity and they are using a generator. And as you know, the electricity in Gaza is extremely expensive, and we really can't afford to get electricity in our houses or in, there is no more houses actually. But in general, if you want to buy a house, if you want to buy electricity, it costs around $10 per kilo. And before the genocide, it was only less than 50 cents. So that's really hard for the Palestinian who's living in Gaza to discuss. So that is the situation in general, and really, it is really amazing work. I recommend everyone, and I recommend actually every organization to sponsor such as these projects. And I really talk to you about this with the guy who is building or established this hub, and he's still young actually. The people who's building these hubs, because most of them are young people, less than 30 years. So I can see that there is a great job. We have a lot of intelligent people in Gaza. We are not only, as you can see in the media, that looking for job or something like that. No, we can create jobs actually in Gaza. We can build. We can create jobs for others in the same time. So that is my situation, and that is my comment so far.
Yes, it is the young people of Gaza who are interested more than anyone else to rebuild Gaza. And as you said, Munder, don't just give me a fish, teach me how to fish, and I'll take care of of myself. And this is opportunities about not just giving aid or support to people, which is still is something that we need, but we also need to have a parallel track of uh, creating jobs, job creating opportunities. So when they come to these hubs, whether the one that Mundarin or the one that Russia has, they get education on how to start a career like this, an online career. They get monitoring and supervision,
That's
and
fine.
they also are given the access in terms of reliable internet connectivity, reliable power. It's 24/7. So if we train or get 50 young people who, as Munzer said, they're all bright, they're all willing to do the work. If you teach them, if you coach them, and provide them all the means, so you are creating 50 people who have now a career that they can provide for themselves, for their families, and after 2, 3 months, you provide for another 50. So the idea is DAG will support the first few months of their presence at this hub. Russia and their team will provide them with the coaching, with the training, and the access to the international community. And every time we create a new round of young professionals, freelancers who are coming into the market and providing for themselves, for their families, and opening opportunities for the people of Gaza instead of just relying on aid. Anyone has any, Annie, do you have any reflections on this? You're more into
Yeah,
business
this
and
is my
stuff
area.
than
So
me.
first
This
of
is your
all,
area.
Alf
Please, yes, go
Mabruk
ahead.
to Rasha and Dag for having made this connection, because the destruction, of course, is physical, the destruction is medical, but ultimately the destruction is economic. And if we cannot find pathways, we will be perpetually at the mercy of the humanitarian world, which we talked about a while ago, is limited to whether they can access or not the borders. We have to create our own economic engine. So I'm really, really happy to see this part. I've been messaging with Russia. She responded
Actually, yes.
right away.
Actually, I want to connect you with Russia and Munder, and it would be great if Annie, you can run this part of the
Right.
project
So
with
Rasha and
us.
I have been talking the last 10 minutes on WhatsApp already. We're already all over this.
Yeah.
You're
You
really
get,
friends?
yes,
Yeah.
but one of my questions to Rasha, which may be of interest to others, it's of course we've 1,000% support DAG's mission to give some of the enabling infrastructure, which is what you're providing with the
Exactly.
safe space, the connected space, the education space. Mabruk. Can we, through you, and I have a lot of companies I work with, a lot of entities who are very passionate about Gaza and, you know, all need freelancers for different things.
Yeah.
Is there also a portal through you to hire groups, you know, one or many on certain dedicated projects? If you could address that, please. And then you and I will continue our conversation later. Shukran.
Okay, thanks, Anna. And I will tell you about, we have, before this, the genocide, we have a small community for freelancers and expertise in freelancers. And we start with some training about how you can explain your expert and provide for these trainers and you can increase your your information. In last year, we continuously this expertise in our expertise, and we develop some information and can building big communities for these freelancers. In all area, we can, in development, we have communities, and when in content management, we have communities, and in promotion and in media release, all of services can we provide it as a freelancer, as online services. We have small communities, small communities, so we have big communities for these all services. Yeah, I have a data, and I have a lot of communities in WhatsApp and in our basically here. We planning to move to have a weekly meeting for this expertise, so we can share with you a lot of this.
Maybe, Annie, we can add you to the group that we have with Russia and Mariam, and we can brainstorm this further and see if we can take it to a bigger dimensions and expand the reach, whether in terms of job creation or finding contracts for those people with global companies so they can help them more. That's great. Anyone has any questions for Russia? Wonder you're signing from two screens. One of them is moving, one of them is أنا already مضغوط.
والله مضغوط.
كنت بدي اوريك الهاب من برا ما بعرف. Okay, I'll show you how looks like so far. This actually for training. At the same time, actually we have to speak very slow in this hub. So how this is the temperature or atmosphere for this hub. It is almost 9 p.m. and I can show you how's I want to introduce you to the owner of this hub. He is just younger. He's younger than me, and he's less than 30 years, and he can own and he can organize all of the situation.
I think he is a freelancer also.
مش مشكلة. لا صاحبك هذا. اللي حكيت لك عنه مرة. بس قول له أيوة أنا صاحب المكان.
مرحبا كيف الحال؟
بدي يفهم الحوار. As you can see also, there is another upstairs. So this is how he said to me. But من فوق. Some of them actually, one of them actually, he's my friend. So this is how looks like. This is the atmosphere for the hub. خلاص أنا برا. In the hub, you have to speak very slow. That is not affect other visitors or other users.
Yeah, I agree. Okay, Wonder. Muhammad, do you have a question for them, Muhammad?
خلاص راح أرجع أنا مكاني عشان أحكي لكم عن الوضع بشكل عام.
Sorry, I'm on the plane, so it's hard to hear. So I just typed out my question.
for the education portion, is it, is it offered freely to students, or is it also something that is?
So part of this is going to support the students, all kind of, students who need access to internet and, the power. So, yes, DAG will be covering the expenses of the students for being there and having access to come to this space so they can do their assignments, they can do their research. So yes, in that part, it's not charitable, but I mean, it is covered so we can help the students too. So there is job creation part, and there is also help for the students part too. Because
Very much through DAG.
many students don't
So
have
always
access.
good to hear.
Yeah, many students don't have access to internet or electricity or power, and this can be challenging for them. So we are, with the help of Russia and Monzer, hopefully trying to get this opportunity to them. Okay, Russia. I don't want to
Okay.
take you anymore from شو اسمه الصغير حكيت كمان مرة؟
نعم.
شو
يوسف
اسمه الصغير؟
يوسف يتعشرك
Yeah,
شو
we don't
بتنسى
want to take
كثير
you
انت.
anymore from Yusuf. Yusuf, تشرفنا يوسف. دير بالك على حالك، دير بالك على امك يوسف. Okay, take care of yourself, take care of your mom,
Thanks.
and don't give her a hard time يوسف. Okay? انت بتعذبها لامك؟
Okay.
Do you give her a hard time ولا she gives you a hard time؟
لا شاطر يوسف. بعرف إنجليزي.
تعرف انجليزي؟ Are you a troublemaker يوسف؟
خلاص اجيب له فرج خليه يتكتل هو وياه.
خلص ماشي،
No,
خلص خذ
he
فرج.
isn't
خذ فرج
a
عليه.
troublemaker.
خلاص, next week we will have Faraj, which is the Mundir's son, and Yusuf will become friends, and we can maybe have both of them online
Munder,
together.
next week you will do this meeting here from Vibe
خلاص,
Hub.
next week inshallah.
خلاص
Okay.
وعد I will come for free. You don't need to charge
Okay,
me.
for free.
Okay,
انت
guys.
اسمع، انت مر وانا بضمنك في الحملة، تقلقش.
Okay,
توكلنا
guys.
على الله ولا يهمك.
Now we want to go to Dr. Abdul Wahab Abu Warda. He's a surgeon, general surgery from Al Shifa Hospital, and they have been doing an amazing job by doing surgeries for patients who are on the waiting lists. And as you all know, the medical evacuation from Gaza is very, very limited. They almost even stopped it, I think, now, since they killed the driver, the WHO driver, World Health Organization driver, who was taking the few cases allowed out. They killed him last week, so WHO now stopped all medical evacuations. And as we all know, there are thousands of people who need surgery, who need medical interventions, are not able to go outside. So Dr. Abdul Wahab and his team are helping us, trying to do surgeries for some of these patients that they can be done in Gaza with the support of DAG. We did more than 20 cases already, and inshallah we will be scheduling more, but we need more help and more support from you guys. Each surgery costs about $1,500. That covers the hospital expenses and the doctors and the surgeon expenses and everything. But each surgery is saving a life, saving a human being, so they can stay in Gaza and be there with their families and still get the care that they need. The more surgeries, the more help, the more medical intervention we can do in Gaza is better for the patients and also keeps them there with their families instead of, even in the best case scenarios, even if they are evacuated, this means that they're going to be separated from their families. They're going to be going to countries and places and culture they're not used to, and this adds to the challenges that they're already going through. Dr. Abdul Wahab, what do you want to share with us today?
Assalamu alaikum.
Alaikum salam.
I want to talk the last update from MOH yesterday about the number of cases waiting for referral. 21,000 cases waiting for referral outside Gaza. This number just for the patient who get the referral, and a lot of patients until now not get the referral report. Also about the generator at hospitals, some of generators now off and go to the small generator, and the service inside the hospital will decrease. About our project, last week we finished totally 20 cases, super major cases, most of cases cancer, even thyroid, breast, colon, another cases for closure colostomy. So we helped 20 patients to save life and the change of life equality. We have large number of super major cases, and we need more support to help more patients.
Yeah, thank you, Dr. Abdul Wahab. How many cases did you do, guys, so far?
20 cases.
We did 20. Inshallah, we will plan once we get enough funds, we can plan to do the next 10 cases. We're working with Abdul Wahab. I know because of the war in Iran and the war in Lebanon, much of the world attention has moved away from Gaza. It's been hard to get the support that we need. It's hard even to hear the updates of what's happening in Gaza, but the genocide in Gaza continues. The blockade continues. The lack of medication continues. The restrictions on aid and getting anything into Gaza continues. Even allowing doctors to go inside Gaza on missions has been restricted even further since this war started. So please do not forget about Gaza. The people of Gaza continue to undergo genocide. They continue to be killed by all kinds of means. And there is also daily killing. So there is no real ceasefire. People are still getting bombed. People are still getting sniped and shot every day. Muhammad, do you want to share anything about the work with Abdul Wahab? I'm waiting for Iz. Maybe we can have Iz back for a minute to share his work also.
Don't know much. Just kind of, I'm proud of the work that he's been able to do, especially because, like he's mentioned, they are very important cases. And as you mentioned, transport outside of Gaza unfortunately stopped or was stopped recently. Just hearing the stories of the families, it's inspiring, and I encourage everybody to check on the DAG on the DAG Instagram and see. That while it is one case for a patient and for us here in DAG, it is a lifetime, and it is a family member and a community member for that person who is having their case resolved. It's a mother who's able to take care of her children again, a father who's able to go out and work and provide for his family. And so I'm proud of what we've been able to do, and encouraged. Always proud to be a member of DAG, and always very much encouraged by the work that Dr. Abdul Wahab.
Thank you. Dr. Mohammed Kuzais is our colleague from Colorado. He has been on multiple medical missions to Gaza. The last one was like a month ago, and he was there. He was an eyewitness to the situation. And as he said, imagine yourself or any family member of you diagnosed with cancer, and they have to wait a year or two on the waiting list to be evacuated. We know that by that time, the cancer would have been spread, and any treatment done after that will not really help. It will come too little, too late. And if we can save one life, save one patient, one family member, one mother, one father, one son, one daughter, one grandmother, by providing the care, the surgery on time for them. As we all know, with cancer, I mean, when you intervene, makes a lot of difference. So if we do the surgery early enough, um, we are improving their prognosis, we're improving their quality of life. At the same time, we're doing it in Gaza. So please support us so we can support Dr. Abdul Wahab and his colleagues so we can help more patients in Gaza. And don't forget, we have also a fundraiser for our colleagues and our people in Lebanon. We have this in the chat. For those who joined later, Dr. Evelyn Hitti gave us an update on the situation. It's very catastrophic, and it's really hard to be a witness to this and see what's happening there. So any help, spread the word. If you cannot donate yourself, please donate as much as you can. If not, please spread the word. We need all the help we can get. And we also need your voice, your advocacy to stop these genocides and these war crimes. We are also joined by another colleague, Dr. Azzuddin Shab, who is a doctor in Gaza. He himself started a medical clinic on his own initiative for the last year and a half during the genocide. And because in the area where he is, because of the area where he is, they don't have access to care. His clinic, it's called the Rahma Clinic, has been very busy. They are seeing more than 120 or 150 patients every day. Most of this, he's been doing it on his own. He's been providing free medications, but he could not provide for all the patients. That's why Doctors Against Genocide is helping him at least cover for some of the expenses, some of the costs that they need. Dr. Azzuddin is also a writer. Follow him, please. Follow his writings, his Twitter or his Instagram accounts. He really reflects very deeply on the human level, regardless of politics, on the human level. What does it feel to be there as a doctor, as a human being, as a patient, as a neighbor, and everything? So, Azzuddin, go ahead and share, please, with us.
Hello, thank you so much. I'm very happy to be with you all again today. I hope you are all doing well and that your families around the world are safe in Lebanon, Palestine, Iran, and Sudan. Today, I want to take you inside the clinic, but not just to tell you what we do, but to show you what life looks like for people here over the past 2 weeks. In Gaza, people are living in conditions that are extremely dangerous for their health. And I want to be very clear when I describe this, I am not exaggerating. In many ways, the environment people are forced to live in is not suitable even for animals. This is simply the reality here. Because of the war and the destruction of infrastructure, there is no longer a proper sewage system. People are forced to dispose of wastewater in the most primitive way, digging shallow channels in the sand between tents. These are the same places where family sleep, eat, and try to live. This creates a perfect environment for insects and rodents. And over times, there are no longer rare incidents. They became part of daily life. A few days ago, a woman came to our clinic. She was calm, almost too calm. She told us that her child has been bitten by a rodent. I have shared the full story on my Instagram, so you can check it there. I don't want to take too much of your time by telling this story. But she said she had cleaned the wound and simply wanted to know if anything else needed to be done. What struck me wasn't only the incident itself, but how normal it had become. In any other place, this would be an emergency. Here in Gaza, it is something people have learned to live with. And that in itself is a disaster. At the same time, we have been noticing another deeply concerning trend. Over the past weeks alone, we diagnosed 3 cases of suspected breast tumors. We referred them to to a specialist for a biopsy to determine whether these masses are benign or malignant. But even this basic step is out of reach for many people because a single biopsy in a private lab costs around 800 shekels, an amount that many families simply cannot afford. And public hospitals offer it at a lower cost, but due of overwhelming demand and limited specialists, results can take weeks. And when when we are dealing with something like cancer, weeks can make a difference. As we approach summer, we are also bracing for another wave of health issues. Skin diseases are already beginning to spread. Infections like scabies, chickenpox, and other conditions that thrive in overcrowded and unsanitary environments. Now, we see children covered in rashes, constantly scratching and unable to sleep. We see mothers trying to soothe them with whatever little they have. And every day, the number of cases increases. But perhaps the most most difficult parts is this, that everything we are doing feels like treating symptoms, not the cause. We provide care, we relieve pain, we do what we can. But the root problem remains untouched. The blockage, the closed crossing, and the war. These conditions are not natural. They are not inevitable. They are imposed. And as long as they continue, what we are seeing in the clinic will not end. It will only grow worse. People here are not just facing illness, they are being forced to survive in a system that denies them the basic conditions of of a dignified life. And yet, people here, despite everything, they continue. They woke up, they bring their children, they wait in long lines because they hope. And that hope is something we try to protect every single day. And before I finish, I want to say something very important. Your support means more than you can imagine. It is not just number or donations. It is the difference between someone receiving care or being left alone in pain. Here in Gaza, even the smallest act of support carries real weight. It reaches real people. It changes real life. So please don't look away. Don't allow this to become just another story that fades with time. Stand with us because for many people, this is a clinic. It is the only place they have left. Thank you.
Thank you, Dr. Azdin. Sorry, I missed some of it, but thank you for sharing this. I'm gonna go back in the recording. Anyone has any questions for
No,
Azdin?
I just want to add something.
Go ahead.
While we are having this conversation, like 1 hour, 1 hour, yes. There's a child. Her name is Sham. Has just died. She was waiting to be evacuated for treatment, but she was waiting for a chance for care that was simply not available here. But unfortunately, she died today.
How old is she?
I don't know, but I saw her picture in Facebook. Her family shared her picture. I can show you if you want.
Sure, go ahead. Tell us what's the story behind her. I'm sorry I
This
missed
is
that.
so. What happened?
Wow. Yeah, she looks like a baby. Oh my God.
Yes. This is a child. She was waiting and didn't survive long enough to be helped.
To be evacuated, yeah? She was waiting for
Yes.
evacuation.
Yes. She was. Yes.
Yeah, and that's another reminder that so many people were
Yes.
losing from preventable deaths while waiting on those, long waiting lists. This is a sad situation of humanity, knowing that all of this is intentional, all of this is man-made, none of this is a natural disaster.
Exactly.
These people, they can get the real good care in Gaza if Israel and the United States allow the medication and the equipment to go in, or if they allow them to leave and get treatment somewhere else. So they are blocking both ways. في مثل بالعربي بيحكي لا بيرحموا ولا بيخلوا رحمة الله تنزل. They're
Yes.
not helping and they're not allowing others to help.
Love you.
And this is the definition of a genocidal state, genocidal regime, genocidal nation, and genocidal empire that wants to destroy humanity. Dr. Sui Yang, I know you have a question. Dr. Sui?
Yeah, I just wanted to ask, where is your clinic? Which part of Gaza?
In Jabalia, north of Gaza. Exactly in Jabalia.
I know Jabalia. Yeah, okay. Oh, God give you strength. It is a terrible situation, but if you're not there, all these people won't have your help. Okay. So
Thank you, Azzuddin, for all what you do. Thank you, Abdul
thank you
Wahab.
very,
Thank you,
very
everyone
much.
in Gaza. Thank you,
I have
Russia.
one thing.
Go ahead, Muhammad.
Can I add one thing, Nidan? I think
Yeah.
every time I talk to Dr. Azzuddin, it's kind of a twofold approach, which I think is very specific to what DAG does. One, trying to provide relief work on the ground, and two, the importance of the advocacy work that we're doing. I know, we have the Thousand White Coats on the Hill day coming up soon, and both aspects of DAG's work cannot be understated. It is very important to support the work that Dr. Azzuddin, Dr. Abdul Wahab, and others are doing in Gaza. And it's also important to show up to try and I think Dr. Azzuddin put it really nicely to try and treat this issue. In America, we got the saying that an ounce of prevention is worth a pound of the cure, and so we have to continue pushing, continue approaching this problem on both fronts, because all the doctors and all the people in Gaza are doing amazing work, but there is just so many more resources available outside of Gaza that we are hoping to be able to bring in or provide for them if they're able to get out.
Yes, thank you, Muhammad. Reiterate your point. We need to stop these war crimes, these genocides, these wars, and also we need to provide the communities in the meantime to help them survive these criminal atrocities, committed against them. And to add insult to injury, it's not that they are committing all these crimes, they are trying to silence us from speaking against these crimes. That is part of the genocide enabling complex. So they don't want people to even talk that there is a genocide being committed in Gaza and Lebanon and Iran. And anyone who dares to talk, anyone who dares to say anything against these crimes, they are either arresting them or firing them or punishing them in many other ways. And this is happening all over the world, especially in the West, which is the West supposed to be the champion of freedom of speech, the champion of democracy, of universal human rights. Unfortunately, all these crimes this time are being committed by these Western countries, by the politicians, not the people. Fortunately enough, the people of the world, the people of good conscience, whether they are in the West or the East, have been all been awakened to these crimes, to the crimes that their politicians are committing in their name without their consent. And an example of this is what's happening in UK, as Dr. Sui is going to share with us. In UK, many of her colleagues have been arrested in London, I think yesterday or the day before, because they only dare to speak against the genocide. And they're asking their country not to be part, not to provide weapons, not to support this genocide. And Dr. Sui, if you want to share with us, please. I know many of your friends have been
Yeah.
arrested illegally. Go ahead.
Thank you very much. You know,
And
we
before you go, please, can you please? But in the meantime, please help us to support Dr. Azzuddin, Dr. Abdul Wahab, Dr. Evelyn,
yes,
the
yes.
link, the support DAG, so we can support them and support the fundraiser for Lebanon in the chat. And at the same time, keep up your voice. Do everything you can to stop these crimes, as Dr. Sui is going to share with us in a minute. Go ahead.
I think before I began, you see, the principles are always there. I think the first most important thing when it comes to supporting Palestine is to speak up. But then the equally important thing is relief. Help the Palestinians live, because they cannot live on nothing when everything which they have is destroyed. So this goes hand in hand. So I really, please donate. I think there's all these links here, help the clinic, help whatever you can do. Okay. And if you don't have a lot of money, a few of you can get together and work out some way of supporting it. I know this Wednesday is the Thousand White Coats Day. I can't come, but I managed to get myself invited to the House of Lords. So, which is, well, I will have plenty of things to say. I'm especially angry because, ever since, I've been in this for 43, 44 years. But recently with the genocide, we are seeing people being killed by 1,000 pounds bomb, 2,000 bombs, and white phosphorus, quadcopter, and so on. So a group of very, very passionate activists have decided that we have 10 Israeli arms factory called Elbit scattered all over UK. They shouldn't be here. They shouldn't be here making, drones, making phosphorus, making weapons to kill Palestinians, not only Palestinians, but all over the world. But they're basically a non-violent group. So they decided that they are going to blockade the Elbit factories in the UK, and also, they can spray paint red paint on the factories and smash the glasses. So many of them are arrested. So actually, the category of arrest is vandalism, okay, this destruction of property, which is not terrorism because they have never hurt anybody. It's not directed at people. And our government decided to declare this group a terrorist group and use all the horrible kind of anti-terror laws against them so they can be arrested and keep in prison without trial. And, it is, and we are not allowed to support them. We are not allowed to say anything for them. Giving them money is also illegal. So the founder of this Palestine Action Group challenged the government in High Court. And the High Court judges all agreed that they are not terrorists. Whatever they've done come under the category of destruction of property, vandalism, which are crimes which does not merit the treatment of terrorists, because terrorists, okay, it's terrible. It means they can come into your house in the middle of the night and just pull you up and you disappear. So under this, we have 32 of the activists arrested, all doing prison, some for about 18 months, 2 years, without trial. 8 of them went on a hunger strike, and there was a big campaign that we launched because I think I'm too old to actually climb into Elbit factory to smash up glasses. Maybe if I'm 30 years younger, I'll do that, but I'm too old, so I can't do it. But at least we can support them. But then the High Court ruling is that they're not terrorists, therefore they're not proscribed, so we can support them. But yesterday, our government has decided to treat them as terrorists because they are going to appeal the High Court. And based on that, our police has arrested more than 500 people, and many of them elderly. The oldest arrested is 87 years old, the youngest 27 years old. So many of my elderly friends have gone to police station last night. Some of them are bailed out, so it's okay. I think they got to bail most of them out because basically they're just sitting on the floor with a placard saying, I oppose genocide, I support Palestine action. That's all. You get arrested. So this is the kind of police state we're living in. And personally, many of us get, terrible things happen to us. And if you're a doctor, they've weaponized the anti-terror laws and use that to get the GMC suspend us. Ghassan is a typical case. He's winning all his tribunal, but now they're going to take him to High Court. So it is very messy. And so is Dr. Al-Radwan and Ellen, who's a Jewish doctor, and many others. So this is the state of play. And I'm not asking anybody to support Palestine action. Anyway, it's illegal to give them money, so forget about it. But I think we have to speak up. There's no choice. Many of us cannot go to Gaza and help people in Gaza. But as doctors, we got a voice. If 1,000 white coats turn up in Capitol Hill, it is something, isn't it? The press will have to report it. And your voice have to be heard. This is a special power that you have. If I present myself to the House of Lords on Wednesday, when you're doing this in Capitol Hill, I can mention what they're doing to their lordships. So this is a battle we take on all fronts. in many, many different ways, we can support Gaza by amplifying the voices of their doctors, amplifying the voices of the people, who are writing their history with their own blood, right? And also by supporting them, helping them to live. That's all I've got to say.
Thank you, Dr. Swihang. Very powerful, very important reminder for all of us that for those of us who can go there and help, that is great. For the rest of us, we're still obligated to speak against it and do everything in our power to stop it. Whether you are in the UK, whether you're putting your safety and your comfort at risk, as Dr. Swee is doing, and her colleagues who have been arrested or fired, and whether here in the US. To speak more on this, we have two doctors, Dr. Mark Bruner and then Dr. Joan Ruhr, can speak more about us here in the United States, what we can do, what more we can do to stop these crimes. But before that, we have Barbara Edwards. She's from the audience. She had a question. Barbara, are you there? Do you have a question, Barbara? Barbara? Barbara Edwards? No? So I'll leave it to John or Mark. Who wants to go first? Mark, your camera is not on, so I'll go with John. And then think, John, you are also about to participate in another event or another action, which is the flotilla. So if you want to just update us on we as doctors, what we can do, give us options and weigh how important each one of them is. Again, each one of us needs to do something, and there are so much we can do. And Dr. John can give us what he and some of his colleagues are trying to do this coming week. Go ahead, John.
Yeah, thank you, Nadel. I just wanted to add to Dr. Swee's appeal that we all have to speak up. That's the most important thing at whatever level you can. In such awe of you that are still practicing full time and doing this incredible work. It's just amazing. I do a lot, but I'm retired and I don't feel anywhere near as energetic as you all might be. But it's clear that governments are not going to stop this. Governments, I call them the Epstein class now, are all in the same boat. They will only succumb to people power pressure. And it's really all of us that have to do everything we can at the level that we can. Um, so my next step, having done everything that I've known to do before, is to join the flotilla to Gaza this week. So boats will sail from Spain. Boats will then go to, I think, pick up some in France and then go to Italy, where I will be traveling this week to train and prepare. Then we leave next week for Greece and then Turkey. And if all goes well, we'll eventually land a boat in Gaza at some point. 40 boats were attacked, 645 people arrested last year, many abused. We'll have 2 to 3 times that number this year. The security situation, of course, is much worse because there's an active war going on, and it'd be easy to make the case, well, those fools went into a war zone and got hurt. But so we have a lot of people really paying attention to security. And I don't want to do anything foolhardy, but we don't want to give up either. And so the centerpiece of this flotilla this year was supposed to be a medical boat with 1,000 doctors or 1,000 medical people on it. And that's been very difficult to work out. They haven't gotten a boat large enough, nor have they gotten enough physician volunteers. But like DAG, we want 1,000 coats, and maybe that'll still happen Wednesday, but it's more likely we'll have 400 or 500. But whatever we have matters. And we've just got to keep plugging away. Tomorrow, I'll speak on behalf of DAG for the nurses, National Nurses Union, and appeal to their strength and skill as unionists, because unions are the one organized people power that has practice in challenging the system, holding people accountable, and teaching people what to do when the system is just incalcitrant and does these horrible things. We've got to learn how to strike. We've got to learn how to withhold taxes. We've got to step up to where we have the power and not the people with the police state. So proud to be part of DAG doing all this. Every little bit helps. I'm sorry Mary Beth won't be on it. We both got blocked 2 years ago. But I noticed she had time to do that kind of thing when she worked for the military. But when you're as a doctor, the commitment is so much greater than the people that do the other, I think. And we need to make the population realize that. I think we have a lot of credibility as doctors, but the military gets a lot of honor because they're willing to give their lives. And we've got to overcome that. We've got to show the difference between giving our lives to help people and giving our lives to hurt people. And we have that advantage. We have truth on our side. And I'm just so happy to be part of all this. The flotilla does need more support. If you know anybody that's looking, it's too late to start in Spain, of course, but by the time we get to Turkey, we'll still be looking for medics and doctors. They need doctors for both a medical boat and a medic on each boat. And so there's a place there for people ready to go to that extra step. Thank you.
Thank you, John. Thank you. We're proud of you. We're proud for all the work you do. And we are actually jealous from your energy. I mean, he said he doesn't have energy. This guy went on a mission to West Bank last year and he was denied by Israel and he was deported. A couple of months later, he had to have a major surgery. And I think 3, 4 days after his major surgery, he insisted to come and join us in DC in another event like the one we're going to for this Wednesday. And he actually participated in a press conference only a few days after a major surgery. So, John, all respect. Thank you. Stay strong, stay young, stay brave. We are learning from you and from Dr. Swiyang and from Dr. Mark Brunner, from Dr. Khan, from all of our colleagues. So please, yes, support the flotilla. We need 1,000 doctors, healthcare workers go on the flotilla, and we need 1,000 doctors, healthcare workers go to DC. We need us everywhere. This is our humanity we are defending. This is our humanity we are protecting. This is our profession, our oath, our moral obligation to do everything we can to protect life and to prevent the unnecessary loss of life. This is the oath. This is our oath. This is why I went to school, to protect life. So please, please, everyone, do more, try more, and join any initiative that works for you. Every one of us, some can go to the Frutella, some can go to DC, some can go to the House of Lords in UK. Go ahead, Dr. Swiyang. You raised your hand.
Yeah, I just want to ask John. John, if you're sailing from Europe to Gaza, it will take you about 2 months, right? I assume you're going to stop at different stages, and the last stage will be somewhere, either in Greece or Italy and going straight to Gaza. Is that the way you operate? Because I was on the flotilla in 2018, I tell you, I was so seasick that everybody on board was so worried about me. And I thought it was a joke, I don't know how you it is really pretty awful if the boat is small. I can tell you that.
I'm a little worried about that, actually.
You better go and get some very, very good seasick medicine, okay?
Yeah. Well, I'll take any expertise from this team on, since anticholinergics seem to be the most effective anti-seasickness medicines, and I've got
John, I brought scopolamine patches ahead of time for the last flotilla. That I just asked, can I have one? I might be on a tiny boat in the Mediterranean, and obviously we know the smaller the boat, the more movement it has. And was just ready just in case. So, and that seems to be most effective widely for people, is starting with half of a scopolamine patch.
Okay.
Yeah. Hey, this is Mark Bronner. And I totally agree about the scopolamine, but make sure you take them ahead of time. When I was in Tunisia for 21 days with the Global Samud Flotilla, and we were not able to obtain scopolamine there. So in North Africa, it's a little bit more difficult, at least to obtain that. So you might consider taking some ahead with you from the States.
Okay.
Well, Mary Beth, you haven't had your rotation on urology yet, where you'll see a lot of older guys with prostate issues who would be terrified of taking scopolamine.
Yeah, I feel like I need scopolamine.
Just a wee spot behind the ear, right?
I'm sure I'll try it.
Yeah, I'm giving that also. I was giving all that to my patients, but it didn't occur to me that I need to take it myself, you see. And that was so ill. I think it's Mazin. Mazin Kamsia was on the same boat with me, and then he said, "We take this. It helps."
Yeah.
We got all the best. We'll be thinking of all of you.
Yeah.
Okay.
Keep us updated and good luck, John. And
Yeah.
please support
And
John, support the flotilla, support their work. Go ahead.
yeah, please. We'll be thinking of you. Okay.
And we have also Dr. Mark Bruner. I hope you can put on your camera too. Dr. Mark Bruner is an American U.S. Emergency room physician. He's been doing this for decades now. It seems, I don't know, there is a heavy presence of ER doctors in the humanitarian work, because I see most of the names our colleagues who have been going on missions all over the place are ER doctors. So we're really proud of them, and we are really proud that they are leading this work. Dr. Mark has been on a mission to Gaza, and he's a witness to what was committed against the people on Gaza, and he's been outspoken against these crimes as a human being, as an American, and as a medical professional. We're proud to have him. We're proud for his service, and he's also going to join us next week for April 15th, the month of the International Month of the Awareness and the Prevention of the Crime of Genocide. So thank you, Mark, for joining us. Thank you for your voice. And it's all yours. You want to share with us anything you want about Gaza, about your experience, about why we as a country, as people, should not stay silent, should not be participant in this crime, and also invite more colleagues to join us this coming week on the 15th.
Thank you very much. I appreciate that. Well, you know, the first thing I wanted to really say was that, and I'm stating the obvious, but, you know, trying to, you know, build awareness through social media is incredibly important. You know, both Instagram and TikTok are great platforms for getting your voice out there. And, you know, other things we can do, writing letters to the editor, op-ed pieces. I've published 11 op-ed pieces since June of 2025, and I think that's had an impact. It's I've been invited to a number of television stations and news programs secondary to that, and you know, just doing anything we can, including the Global Samud Flotilla. You know, I spent 21 days in Tunisia. It's a little bit frustrating, but you know, I think I really believe in the cause, and I would like to do that again. I'm very interested in joining the Global Samud Flotilla again this summer, if possible. Yeah, I think, you know, what I'm hoping for is this, you know, classic pendulum in world politics. We've gone from, you know, the extreme right, you know, fascism and totalitarianism and you know, supporting genocide and imperialism, and I'm just hoping that the classic pendulum will swing to the left, and we can hold these principles accountable in The Hague, and you know, start to develop policy that's going to protect populations again from mass destruction and genocide. And so, you know, I think continuing to support progressive candidates in the United States, at least, and that use a justice filter when, you know, when they're thinking about policy. I think those are really incredibly important things, and things that I'm kind of focusing on. And I'm sorry if I'm a little bit distracted. I'm in 4 lanes of heavy traffic driving down the highway right now. So, but you know, these are kind of the things that I'm doing, and I'm really happy to be able to work with, you know, Doctors Against Genocide in the upcoming rally on the 15th. I think this is an important, you know, component to this. I'm inviting my legislators, for what it's worth, to attend. I've been reaching out on email and social media, and making direct phone calls to my legislators, asking them to come to the rally and to support it. I've contacted a number of major news outlets, including Democracy Now!, etc., trying to get some coverage. But you know, just staying active. I'm hoping to. I put in my notice my last day of work, full-time ER doc in the United States is June 28th, and so I'm hoping to be able to spend more time as a full-time activist and to do more volunteerism in the region in the coming months. So anyway, that's kind of what I'm up to, and I appreciate everybody's support, and I really appreciate all of the things that I learn when I tune in to these Zoom calls. It's really incredible the dedication and the intellect of the people that are involved with this organization, and I'm just really, really proud to be part of it. That's all I have to say.
Yeah, thank you, Dr. Mark. Be safe. Yeah, if you're driving, we're not gonna take any more of your time, but once you reach your destination, if you want to speak more, you are welcome. And again, we're proud to have you. We're proud that you're joining us. The call from Dr. Bruner, from Dr. Suyang, from John, from everyone is we need to do more. If you can make it to DC, then please join us to DC. If you are in the UK and you want to join Dr. Suyang for any action she can do in London, please go there. If you can join the flotilla, Sumud flotilla, that's great. If not, locally, you can reach out to your local office, your local elected officials. You can talk to your hospital administrators. Tell them that we, as doctors, healthcare workers, cannot continue to be silent in this. I think Dr. Brewer made an important video yesterday that, as doctors, healthcare workers, we do have an extra responsibility to speak up and to do more to stop these things. And silence is not neutrality. Silence is actually giving permission for those, criminals to continue their crimes. So if you are silent, you are actually a participant in this. And you already betrayed your humanity, you betrayed your profession, and you betrayed your country. If you are a proud American, you should refuse that America should be part of this committing war crimes. If you are a proud British, proud any country, no one who's proud of their country should agree or stay silent when their country is participating in committing these heinous crimes against humanity and against our people too, because the fascism is coming here. It's, they're arresting people in UK, they are suppressing the freedom of speech. ICE and the machine here in the United States is not any better, and they're trying to suppress our, free speech. They are actually taking away our constitutional rights as American for freedom of thought, freedom of speech, only to allow those war profiteers and those lobbies and the Zionist lobby to continue their crimes. So make sure that your politicians know this, they hear your voice, and know that you're going to hold them accountable. There is a midterm elections coming in the next few months. They need to know, every one of them, that there is a price if they continue to be silent or continue to vote for more bombs to kill children, more weapons, and more wars. This is not who we are. This is not what we agree with. And April 15th is also the tax day, which means our taxes need to be used for us, for our communities. Our taxes need to be used to save lives, not to kill people. The taxes, your hard-earned money, should be used to save lives, not to kill more people and more children. So thank you, everyone. Thank you for being with us. Karama, are you back? So maybe Karama and Iman and Dania and Maribeth can lead the talk now about our coming action for April 15th. Karama is on
Thank
call
you.
as usual.
Yeah.
We are all busy guys. We all have full-time jobs. So we're trying our best to do what we can. And she was rounding earlier, so interrupted, but inshallah she can have the opportunity to speak more now.
Thank you, Nidal. Well done as always. So thank you for all our speakers. I feel that Dania and Iman should talk to us about the action. We're very excited to be there. We're also nervous. This will be our biggest gathering since Doctors Against Genocide started. We have over 600 people signed up, and we keep hearing that more people will join us. So we feel we all should be very organized and very careful and very, look forward to meeting all the colleagues and making new connections and making new friends with them. And we also have almost 40 appointments to organize. We need to organize participants. We need to organize people for the press conference. So we look forward to meeting everyone. And Dania, Iman, would you please talk about the structure? I have to go. I got paged actually.
Karama, you should be a full-time DAG. Why do you have to work, Karama? Come on, guys. Make us rich so we don't need to work. Oh,
Okay.
you are muted, Karama. You are muted.
It's just a few minutes to work.
Okay, that's fine. Okay. Iman.
Either I can do this or Daniel, but we would love to have you guys this Wednesday the 15th at the Hill. The more the merrier. This is definitely going to be the largest number that we've had, but we were given a challenge to get 1,000 doctors there, and mashallah, we're gonna get pretty close. We're meeting at Union Station at 9 in the morning in DC. And then from there, we're going to head over to press conference. And then between 1 and 5, we have about 40 meetings scheduled with senators and representatives. If you're coming to join us, please be patient with us. Just a reminder, we are all volunteers and we are really kind of learning as we go. I think part of the most important thing about this is for them to see a large number of doctors. Bring your white coats, healthcare workers, nurses, mental health specialists, whatever. Bring a white coat. For them to see, that we're not okay with this, and to keep them accountable, because, as it's been said several times today, people are very much, they're focused on other, important things that are going on in the world too. But, Gaza's still under a genocide. And it's an interesting, every time we go, many of the offices do thank us for doing that. They're like, thank you for helping us stay focused on Gaza. And so, like I said, it's not too late to join us. So please join us and just be patient with us. We are going to try to assign people to groups to go to at least 1 or 2 meetings. You may not end up going to see your senator or your rep just because of the sheer number of peoples, but we're going to do our very best. But that'll just give you an excuse to come back with us again to the Hill on another time. Dania, do you have anything else you want to add, or?
No, you pretty much covered it, but yeah, please join us. I think the significance of this action is for us to have a large presence. We want to be everywhere. We want the media to be forced to pick up this and put it back in the headlines. The stakes feel really high right now. So I encourage everybody to join us. And the idea and the significance of this is to have a large presence. So, everyone counts. If you have not decided or you've been on the fence, as many of the doctors that shared testimony today. And, I think we have to keep talking about this. And unfortunately, in the US, it's not normalized. People are not having these conversations like they are in parts of Europe, where it's just regularly discussed. It's still very taboo here in the US. So please join us. We're excited. We're also nervous, but together we're stronger. And yeah, please join us.
Yeah, thank you, Dania, and thank you, Iman. And again, the main thing, as Iman and Dania mentioned, is the numbers. We need to show them that there are so many of us coming to DC to tell them this is not acceptable. We cannot stay silent. And this call is not just for doctors. Any healthcare worker is welcome to join, whoever you are, any supporter, any patient, our colleagues, our friends, our neighbors, our community, everyone is welcome to join us. As Iman mentioned, the more the merrier. And anyone who believes in this mission is welcome to come and amplify this message. And again, we're doing this on behalf of a complicit medical community because we refuse to be on the wrong side of history, and we refuse to say when we get asked 10 years or 20 years down the road, what did you do when there was 3, 4 genocides going on at the same time as a medical community? We need to tell them that we, the few of us who are brave enough, who have enough integrity and enough conscience, refused to stay at home and just stay busy about our own business and making money, because they turned medicine into a business and a work for profit. That we, the few of us who dare to say no, who care about the real mission and soul of medicine, is to save lives, not just for profit. We mobilized and we went to DC, and we made sure that everyone knew that we are not okay with this, especially in this month of April, the International Month of the Awareness and the Prevention of the Crime of Genocide, and on the day of the tax day for those who are here in the United States, where our taxes, instead of being used to save lives, instead of our taxes to be used to save our communities here, they are sending them to kill other people, kids and mothers and fathers. We refuse this. And at the same time, while Trump regime is demanding to increase the budget of defense from 1 trillion to 1.5 trillion. They're asking for another $500 billion so they can kill more people and they can make more money to their handlers, the ruling class, the Epstein class, the Zionist class that's killing all of us. At the same time, cutting down on Medicaid, cutting down on health care for us, leaving more and more Americans with no insurance, no access to care, cutting down on basic services, on daycare, on schools, and all these things, cutting down on these, but making or sending more money for the war machine to kill more people. Out of everyone, I think every American should be appalled by this. No one should agree with this, but at the forefront should be the medical community. And never sell yourself short. The medical community in the United States or any country in the world, you can cripple any country. You can bring any president to their knees if we really mobilize, because the medical community is very powerful, it's very strong. Nothing works if the medical community says no. The only reason the politicians have been getting away with this is because the medical community have been silent and complicit and agreed to be part of the system, which is the profit system. But if more of us mobilize, if more of us disagree with this, we can have enough leverage and enough power to make sure that politicians are answerable to us and they listen to our concerns and they use our money and our taxes in a more conscious way and in a way to save more lives. Is this extra $500 billion can give universal health care for every American. It can end the problem of homelessness. It can end the problem of housing for the poor and the vulnerable communities. We can solve so many problems here in the United States with another extra half trillion. Just imagine the number, $500 billion. How much good we can do with this money instead of Trump and his regime giving it to the warmongers, the more regimes, and to Netanyahu and Ben Gvir and Smotrich. Imagine yourself working day and night, paying taxes, so Ben Gvir can take them and give more guns to his settlers, to his criminals to kill children. Imagine that. You are working for Ben Gvir. You are working for Netanyahu. You are working for Smotrich. I mean, this thought by itself should make every one of us just jump and go to DC, call their politician, call their representative. I do not approve of this. If you are being handled, if they have files on you, that is your problem. But me, as a human being, as a citizen, I don't want my money to go to Ben Gvir so he can kill more children with his messianic supremacist colleagues and regime, the rest of the gang that they have there. Karama, you're back?
I am, yes.
So you came back at the same time with Dr. Ahmed Al-Farra. Finally, I thought he's not going to join. So we have Dr. Ahmed now. So guys, please join us. DC, April 15th, this coming Wednesday, this week. Whoever you are, a doctor, a nurse, a healthcare worker, an activist, a teacher, an engineer, a lawyer. We need lawyers. Please come. We need lawyers, everyone, to be there and to make sure that our presence, our voice is heard loud and clear. We do not approve of this. دكتور أحمد أهلا وسهلا نورت.
حبيب قلبي
كيف الحال شو أخبارك؟
الله يمسك بالخير.
ايش الحلاوه هاي النظارات هون مشبح اليوم خير ان شاء الله. كم نظاره معك؟ شو كان على البيتش تعمل تانينج ولا what's happening? You have too many glasses man.
والله انا انت بتقول في انا امبارح سبحت في البحر.
بجد؟ رجعت ايام السباحه زمان؟
يعني سباحه حقيقيه ويعني ودخلنا حوالي 500 متر.
كمان. But just be careful man. We have Dr. Salman here. I don't know if he approves of this message or not. Dr. Salman, do you allow him to go and swim now?
Hello, I'm Dr. Al-Farra. It's good to see you. I think he can do whatever he wants.
Dr. Salman, how are you, my brother?
Alhamdulillah, Habibi, كيفك?
Today I saw a report Dr. Ashraf sent. You prepared it about daytime in Gaza. It's really amazing work. Thank you.
Jazakallah khair. Means a lot coming from you, Dr. Al-Farra.
Dr. Salman, you said a couple of words in Arabic. What did you say? What did you tell Dr. Ahmed?
Oh, I just said, how are you? Yes, كيفك?
Yeah, احكيها بالعربي. Say it again. Can you say it again in Arabic, please?
كيفك Dr. Al-Farra?
Habibi, we miss you. Really, we miss you.
Thank you so much, Miss Khazza.
Is Dr. Ashraf Abul Aziz with us today?
No, he
Dr.
said
Abul Aziz is busy.
He's a little busy. Please pray for his mother. She's sick. He had to go be there with her in Canada. She has been admitted to the hospital. So please, everyone, pray for Dr. Ashraf and for his sick mother. Inshallah, Allah yashfiha wa afiha. And actually, because he's not going to be able to join us next week, he sent his son. His name is Dr. Muhammad Ashraf Abul Aziz. He's a medical student. I think a 40-year medical student is coming to us. We met him on the webinar the other day, and mashallah annu, like father, like son. He's even more energy and more power. So the Abul Aziz family is going to be very well represented next week. Please, prayers, everyone, for Dr. Ashraf's mother. Dr. Ashraf and Dr. Salman, they both were on a mission to Gaza last month. We're proud of them. تفضل Dr. Ahmed.
Okay, my brothers and sisters, really today was full of events. Even today is a holiday in Ministry of Health, but I was engaged to come to the hospital as I have three jobs. The first job was that today we have here Al-Azhar University Gaza, Palestine Faculty of Medicine. This is a research title, Comparative Study on the Prevalence of Preterm Birth Before and During the War in the south of Gaza Strip in Palestine among the war. I was one of the supervisors of this research with Dr. Muhammad Zogbor and Dr. Muhammad Zemmo. And there is also external supervisors from South Africa and from England. Really, today, while we are discussing the presentation with our student from Al-Azhar University, I really told them that I felt myself that I'm in Cairo University or Ain Shams University in master degree or an MD degree, not on baccalaureate of graduation of 6 year in Al Azhar University. What I will in conclusion about the study demonstrates a dramatic increase in the preterm birth rates, and if it was worldwide nearly 10% or in sometimes 15% of the whole birth rate in Gaza, unfortunately sometimes it was 35 and sometimes 40%, and this is a very serious and this is a very red flag that we have to talk about, because everyone knows about the seriousness of immature baby or premature baby. We are talking about sepsis, we are talking about respiratory problems, we are talking about necrotizing enterocolitis, we are talking about not gaining weight or stunted growth, we are talking about social and academic disturbance and difficulties. We are talking about autism. We are talking about attention deficit hyperactivity disorder. We are talking about anxiety. So this is a problem that we have to talk about and we have to mention about many times. Inshallah, I'll ask for the presentation on PowerPoint and we put it, inshallah, in the next webinar of Doctors Against Genocide, because this is one of the items of genocidal war that were taken against Palestinians in Gaza, especially premature babies. Also, the second job for me today in the hospital was a conference about the problem of the oil for the engines, the motor engines, that it is responsible for the electricity production in the hospital. My friends, my brothers and sisters, you have to remember that the engines are working since nearly 2.5 years ago. It doesn't stop at all. Sometimes if there is a problem in an engine, we decrease the capacity of the electricity in the hospital. We cut off the electricity about some department in the hospital and try to support it by another part of the engine. And after fixation of that engine, we are returned back to the old engine. The oil that it is responsible for working that engine, the 1 liter was costing nearly 7 shekel before the war. It means $2. Nowadays, 1 liter of this oil is nearly 1,300 shekel. That means nearly $400 or yes, $400. You imagine that 1 liter of oil for that machine equal in its price nearly 400. Is something like crazy to talk about the engine and the power or electricity in the hospital. Also today we have some interview with I think American newspaper. We are talking about the engineering of famine and the engineering of starvation, that it is still continue up till now in Gaza. You have to remember that egg didn't available or isn't available in Gaza nearly since 2 months ago. The 20 eggs nearly cost is 120 shekel. That means nearly $40. That means it's 1 egg is $2, and this is unbelievable price, and it's could be afforded by many of peoples in Gaza. We have to remember that the fresh food is not available in Gaza. The healthy food is not available in Gaza. There is shortage of Formula One and Formula Two in Gaza nowadays, and we asked about that many times. Also, we don't have to forget our colleagues and our doctors, our workers in the jail, in the Israeli jail. Here, one of my best friends, Ustaz Bashir Abu Mustafa. Ustaz Bashir, he's ambulance driver. He's one of the amazing workers in the field of the hospital. He was here in the hospital while it was attacked by the occupational forces, and he was put in jail or arrested for nearly قديش الفترة اللي قضيتها؟ 51 يوم. 51 days. 51 days. Here بدينا كالبشات والعين مغمية. Come here please. استريح معي. This is Ustaz Bashir. دكتور نضال. دكتور نضال.
Sorry
You are
guys.
muted. معايا الأستاذ بشير دكتور نضال لجبور أستاذنا وحبيبنا.
Dr. Ahmed, you're the one who running the webinar today. So it's all yours. We're listening. You run it and we're here for you and for your guests. أهلا وسهلا فيك. تفضل.
Okay, I want to introduce him to you because I'm always talking about Dr. Nidal. Dr. Ashraf also, Dr. Ashraf, he's a friend for Ustaz Bashir, and he met him 2 times while he was in the hospital. Again, Bashir, ambulance driver, he was in the hospital while it was attacked. He will talk in Arabic and I will try to translate. Okay.
أهلا وسهلا يا بشير، شرفنا فيك.
فيش الشحن خلص.
حياك الله دكتور.
كيف حالك؟ عرفنا بحالك، مين أنت لو سمحت؟ عرفنا باسمك وشو بتشتغل.
أنا اسمي بشير أبو مصطفى، سائق إسعاف مستشفى ناصر.
So Bashir Abu Mustafa, he's a paramedic. He drives the ambulance, one of the ambulances at the Nasser Hospital. Go ahead, تفضل.
نعم.
احكي لنا شو القصة، شو قصتك يا أستاذ بشير؟
أنا كنت موجود في المستشفى يعني على رأس عملي، بقدم الخدمة لأبناء شعبي في ظل الحرب اللي موجودة عندنا في القطاع. فضليتني في المستشفى على رأس عملي بقدم الخدمة للمرضى وللجرحى. ظل الجيش يحاصر في المستشفى، وبقى يعني يتصل في المستشفى يقولهم على أساس إنه مستشفى ناصر آمنة ما فيش فيها خوف، خلي الطواقم الطبية موجودة تقدم الخدمة، خلي الجرحى والمرضى موجودين، ما فيش أي خوف، إحنا مش هنقتحم مستشفيات، مش هنعمل أي حاجة يضر أي مرضى أو أي طواقم طبية. فأعطونا الأمان على أساس إنه إحنا نضلنا على رأس عملنا يعني. فبنتفاجأ غير في يوم اللي هم خاشين على المستشفى. تمام.
امتى كان هذا الحكي يا بشير؟
هذا الكلام في 14/2/2024.
So this happened on April, this happened on February 14th, 2024, which is the Valentine Day for those in America or the West. In Gaza, it was not a Valentine Day at all. So while they were working at the Nasser hospital, they were surrounded by Israeli army. And despite the fact that the Israeli army was sending them calls or signals to the hospital that no worries, continue to work, no one's gonna bother you, no one's gonna attack or target the hospital. But on this day, on this day, February 14th, 2024, something happened while Bashir and his colleagues were providing services for the people and their patients and their community at Nasser Hospital. تفضل شو صار يا أستاذ بشير؟
اقتحموا المستشفى وطلعوا كل الطواقم الطبية وكل المصابين وكل المرضى من المستشفى. طبعا يعني المصابين اللي مبتورات رجليهم، اللي عاملين عملية، اللي في الوحدة العناية المركزة، الناس المنومين في المستشفى، لا في كهرباء ولا في أكسجين. يعني في ناس استشهدت وفارقت الحياة أثناء اللي هو قطع الكهرباء عن الناس اللي المنومين اللي على الأكسجين المتوبين. وفي اللي هو مبتورات رجليهم اللي مركبين بلاتين سحلوهم سحل، يعني أخذوهم بطريقة مهينة، لا قيم لا حيادية عندهم، لا مريض أو إنهم يعني ناس منومين في المستشفى، ما أخذوش أي اهتمام في الموضوع هذا.
So on that day, خلينا نترجم. On that day, February 14th, 2024, the Israeli genocidal army invaded Nasser Hospital. They cut down the power in the hospital. Many patients, especially those in the ICU unit, died because of loss of power and loss of oxygen. Many other patients who are in critical conditions were taken out by the army in a very unprofessional, very humiliating, and very rough way. Many of them, their health condition deteriorated because of this. And again, many people lost their lives because all of a sudden, the ventilator machines, the things that were sustaining their life, the oxygen, were abruptly cut off from the hospital. تفضل.
All the intubated patient was executed at that time, دكتور نضال. كل المرضى اللي كانوا محطوطين على التيوب كلهم فارقوا الحياة.
طبعا كلهم، لانه ما فصل كهرباء وفيش اكسجين، فيش طواقم طبية ضلت عندهم، يعني طلعوا
no electricity, no oxygen supply, no even doctors to follow up that cases.
يعني هم اليهود خدعونا.
That was an important thing. So this was like a death sentence against every patient who was on the ventilator and receiving, breathing through the ventilator, through the machines, because the minute they cut off the power, they all died. All the patients on ventilator machines and life-sustaining, machines died that moment. That was an execution order against the most vulnerable, the most sick patient. Go ahead. تفضل.
عندي مشكلة في ايدي كمان هذه. أنا مش ايدي هذا حتى الآن فيها مشكلة.
شو صار بعدين؟ تفضل.
هو كان مكبل الايدين طول ال 51 يوم. He was tightened his hand.
كم واحد أخذوا منكم من الموظفين؟
كم واحد من المستشفى اعتقلوا يوم
تقريبا 30.
31.
So they killed the patients because they cut down the power and they generated the ventilators. The rest of the patients, they throw them out. Even if you are amputated, even if you are in critical condition, they just throw them out. And they abducted 30 employees, healthcare employees from the hospital. One of them is Bashir himself. And he was abducted for about 51 days with very tight, what do they call it? That zip tied on the hands. تفضل بشير، شو كمان صار معكم؟
Here in his hand, Dr. Nadal.
Yeah.
If you can see the scar,
the scar
of the tight of the هذا مكان
أنا ال 51 يوم كنت مكلبش وعيني مغميات، فصارت عندي في ايدي صار مشكلة اللي هو صارت حبس الدم فيها، ايدي تقريبا يعني شبه تحللت، يعني
like gangrene, gangrenous hand.
فأنا أغمى علي في السجن، أغمى علي وارتميت، بعرفش ما بدري عن حالي اللي أنا حاطيني في مكان، وفي طواقم عندهم في السجن عملوا لي عملية في إيدي، وقعدت في العناية المركزة أسبوع كامل عندهم. طبعا تعاملوا معي طريقة مهينة غاد.
So again, they were treating everyone and the healthcare worker that they abducted in a very cruel and very inhumane way. Again, those Ziplocs were very tight on his hand. He was treated very bad to the point that the circulation to his hand was cut off. He felt very sick. He ended up collapsed.
كل رجل في قرن التسريح.
After wake up
حتى في العناية المركزة أنا مربط يعني.
after wake up from anesthesia.
Let me finish. Yeah, let me finish it. So he collapsed and lost consciousness, and he doesn't know exactly what happened after that. It seems at one point they took him, they did surgery on his hands because it seems it developed either loss of circulation or maybe compartment syndrome. And these scars are from the surgery that was done on him without his consent and without him knowing what happened. And again, بعدها شو صار دكتور أحمد when he woke up, what happened?
After that, after he woke up from anesthesia, he found himself tighted, each hand to the bedside and the other hand of the other side, and his lower limbs, the right one for one side and the left limb for one side. One side he was completely tighted by the four limbs.
So even after he woke up and after the surgery, when he woke up, he found himself in the bed there, and all four limbs were tied to the bed, both upper and lower.
They shifted him after wake up from anesthesia to the department. Also, he's still tighted by that way. You have urinary catheter. كانوا مركبين لك catheter.
قسطرة وبمبرز.
he
7 أيام بمبرز وقسطرة.
They inserted a urinary catheter for him.
كانوا بدهم يقطعوا ايده اساسا بس هم يعني
and all the time they told him that his hand maybe after gangrene or compartment syndrome or something like that it may be amputated. He was afraid too much about his hand, but alhamdulillah, thank God that it survived. انت حكيت لي مره انك كنت عطشان كتير.
صحيح.
he was يعني not allowed to drink water at all the time, even after the anesthesia, after being in the intensive care unit. He get out and he asked them many times he want to drink. They never give him any water. Even honestly, he was try to get the urinary catheter, as we told before, to try to have a source of something to drink, because of very thirsty and unable to drink water at all. كان في ضرب في
انا يعني بقوا بالطواقم الطبيه تسيبنا تقريبا مع الساعه 10 11 في الليل لثاني يوم الصبح يضل الجيش يستفز فينا ويخبط فينا ويضلوا يعني كيف يعطينا كلمات نابيه يعني يغلط علينا بكلام سيء جدا.
So the medical staff is leaving the patient at 10 at
بعدين كنت مغمى طبعا
at night.
فترة 7 أيام كنت مغمى.
All of their eyes are covered. Then the army is coming and they kick them and they shout on them and they give them some dirty words about their mothers, their fathers. That's what's happened with them. ايش كمان تتذكر من الاحداث؟
الاحداث اللي هو لا في عناية طبية ولا في عناية في العلاج. انا عن نفسي بقيت كل 20 يوم او كل اسبوعين اخش الحمام مره. الاكل عندهم مش صحي، المي مش صحيه. بقى معي امساك شديد جدا 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 لدرجه بقول لك بقعد اسبوعين و20 يوم ما بخشش الحمام. ولما يشوفوك انت تعبان بدك تخش الحمام بقول لك ممنوع. ففيك مش انا لحالي، اسرى كثير بتلاقيهم بيعملوها على حالهم مش قادرين، لانهم اغلبيتهم مرضى سرطان ومرضى مزمن من ضغط من سكر وكبار سن ما بيقدروش يتحكموا في حالهم.
So they used this the toilet to punish the patient, about not allow for them to get in that toilet and to use it. Also, they use the dogs for punishment the prisoners.
يعني وسيلة الجمع الرئيسية كانت عندهم اللي هو الكلاب.
How did they let you go? كيف طلعوك يا بشير؟ شو حكوا لك؟
أنا طلعوني لأنه أنا في البداية لما أنا أخذوني، يعني أنا كانت تهمتي إنه أنا سائق إسعاف فقط، هي التهمة بالنسبة لهم، يعني إنه أنا سائق إسعاف بس، وهم أخذوني على أساس إنهم يعني بدهم يعملوا عجز في الطواقم الطبية، بدهم يعملوا عجز في الطواقم الطبية، لأن إحنا بقينا بنقدم الخدمة لأبناء شعبنا، و فيش عندنا سيارات إسعاف طبعا، سيارات الإسعاف كلهن تم حرقهن وتم دهسهن بالجرافات والدبابات لما اقتحموا المستشفى، يعني تقدر تقول عملوا شلل كامل في المرافق المستشفى كلها، يعني اعتقلوا الأطباء، اعتقلوا الطواقم الطبية الإسعافية، فبدهم يعني المرضى والجرحى يضلوا الجريح ينزف، المريض يضل يموت بدون ما يعني ما يتلقى أي اهتمام طبي. فهي كانت الفكرة من الموضوع يعملوا عجز فقط. أما هم تهمة موكلة إلك معينة ما فيش يعني.
خلينا نترجم.
أنت بس تهمتك إنه أنت بتشتغل في الطاقم الطبي فقط يعني.
خلينا نترجم. So even the Israelis themselves did not have any charges against him or against any of his colleagues. They did not commit any crime. Their main goal was to shut down the hospital, to destroy the hospital, and shut down the facility from providing care to the community. So when they went in there with their tanks, they destroyed all the ambulances, they destroyed all the equipment. And as many of you have seen the video images of Israeli soldiers going inside the hospitals and shooting the ventilators themselves, the dialysis machines, and the tanks rolling over, they destroyed every ambulance at Nasser hospital. So even them, the Israelis themselves, do not have any charges, not have any charges against Bashir or against any one of his colleagues. The main point behind this was to destroy the hospital, shut it down, so they don't continue to provide the services for the people there. That's why they let him go, because to start with, they should not have invaded the hospital, they should not have destroyed this, they should not have abducted them, and they did not have any charges after him. So even putting him and his colleagues through all of this, with all the humiliation, all the physical abuse and mental abuse they went through, his arm was about and his hand was about to be amputated. His only crime was being an ambulance driver and a healthcare worker like all the others. They did not commit any crimes. Not even the Israelis themselves are accusing them of any crime. It was merely to shut down the hospital. تفضل.
Dr. Nidal, we have to remember that they concentrate on the health worker and the health sector employee. They يعني make them specialized in suffering, in bad dealing with them. And they all of them was infected by scabies and by lices and by insects and by everything. Every dermatological disease you can imagine happened with these prisoners, mainly the health worker and the health sector worker. We have to mention also that there is no food inside. Even the food, if it was available, it is dirty and it is full of mold and either expired date or something not suitable for a human being to use. Even the water was dirty, as mentioned by Bashir, and it is not, it have a bad smell, but you have to drink because it is the only source of water that you can use. كانوا يعني في الانفستيجيشن وفي التحقيق كانوا يمدوا ايديهم عليكم وكذا.
انا انا كسره، في عندي كسر في القفص الصدري. يعني قاعد يضربوا فيي ضرب مش بغرض انه هو بحقق معك، بده معلومه، هو بحقق يعني بضربك بده يزهق روح. ثلاثه، اثنين هام
He
وواحد
has
هام.
he has two fractured in the chest in the both side, two ribs in the right and one rib in the left, and even he has difficulty in breathing after that. He told us that the officer is not interested about any information because nothing of information available in ambulance driver, but he just to punish him, and just as he's ambulance worker or Palestinian ambulance worker in Gaza, he has to be punished and fractured rib in both sides of the lung.
هددوني بالقتل كمان.
And they treated him about execution, and he will not come back to his family again in
قالوا بدك
Gaza.
تروح على بيتك بتحكي كل اللي عندك ولا بنكت لك، انا بنطخك، ما حدش بدري عنك. في واحد منهم شخ على راسي.
One of the
في النادي هذا اول ما خذوه.
one of the officers, I feel something ashamed to talk about that he
كان
urinate
التحقيق بصورة مهينة، يعني مهينة، مش انه
urinate on his head while he was covered his eyes. My friends, sorry for talking about that, but we have to remember that all of the Palestinian prisoners are now suffering from that events in the Israeli jails nowadays. We have to remember that. Last week we sit with Mukhallad. This week we sit with Bashir, and we have Bashir. They talking about events that happens with them. This is will be documented. Inshallah, we will take our right. We will talk about that. We will not stop talk about that, because this will be everyone was in that circle of criminals that punished the Palestinian people. Inshallah, we will take our right from him.
So we cannot forget our colleagues, Dr. Hussam Abu Safiya, and the rest of our colleagues, and all the hostages, the Palestinian hostages, almost 10,000 of them, who continue to endure torture and sadistic treatment in the Israeli torture camps. There are almost 10,000 Palestinian hostages who are still being tortured by the Israeli criminal gangs and genocidal forces. But even those who have been released, even those who have made it out, they continue to suffer. Actually, I want Daniel to talk about that. Every one of them is that was just a life-shattering experience, what they endured in the Israeli torture camps. I know if you are here with the Western medicine angle, you will say PTSD. They're suffering from PTSD from what they went through, but they continue to be in Gaza and undergoing genocide. So the trauma is continuing, and many of them already have lost their homes, their lives. Their hospitals are still not functioning well. So there is an element of PTSD. There is an element of continuous trauma. So I don't know what is going to be the formal diagnosis for all these things. I think the psychiatrists and psychologists of the world and those of Gaza mainly need to come up with kind of like a new way to deal with this. I don't think this ever happened in history before. That people like if he was released and now he's in a safe environment and he has access to the support that he needs, we can call this PTSD. But when he continues to suffer now, even at work, they can still come to Nasr Hospital and abduct him now or shoot him now. Or if he's in a tent, his family are still enduring. So there is an ongoing trauma that is happening, and that needs kind of like a new approach, a new paradigm, different from what we studied in textbooks. Dania, do you have any insight into this, please? The amount or the type of trauma, what do you even call this? What are they? What is Bashir is suffering from? Our guest from last week. All the people of Gaza. It's not just a PT. I mean, just losing your house being destroyed, losing half your family members. These are all traumas, but they're still not safe. They're still subject of worse crimes happening every minute. So this is a continuous trauma. What can we do to help? What's the best way to help with this?
Well, you're trained, you're traditionally trained to remove the threat, and I think the people in Palestine don't have that luxury. I think the threat is part of every aspect of their life, and I think in Gaza, it's kind of, it's the psychological warfare is on every is everywhere. I think those who have been detained, there's always a fear of being detained again. I think the threat on your family is continuous. There's no ability to heal from it because it's just everywhere you turn. And I mean, and I believe psychological resources are probably not prioritized because there's such a medical necessity that's prioritized first. So yeah, it's ongoing. It's to heal from this is just, we have to we have, the occupation needs to, I think that'll help people begin to heal.
So nothing,
Removing is
nothing.
lifting all of these, you know, these the what the you know, I feel like even calling it occupation is such a soft word. It's brutal. So that needs to be lifted, the siege, and that'll help the people of Palestine heal. But I think the conditions now are not set up for people to heal.
So nothing will really help until we end the genocide first. We have to end the genocide first. We have to remove the perpetrators. We have to hold them accountable and to protect the victims. That's first step before even you can think about anything meaningful to help them. So we don't even have the luxury to speak in the past. We're still in the present, and the trauma, the crime continues. And the first thing we need to do is end and stop the genocide first, hold the perpetrators accountable and move them away and protect the victims. Once they are in a safe, relatively safe environment, then we can talk about other, procedure interventions that maybe the Western kind of paradigm might help with. But for now, it's not even applicable. Yeah.
دكتور نضال
Yeah.
انا مش اللي منها اللي فيها مشكله رسمي يعني انا يعني اي تعرضت لاي حاجه ساقعه يعني في الهواء بصير في معي ماس كهربائي.
I think Bashir have a neuropathic problem after that compartment syndrome or after that gangrene with his hand. I think we need neurological consultation to talk about that. Even the effort in that hand is low, and the movement or the power is nearly lost at that hand. I think we need to consult in neurosurgery and neurological doctors about that. I want to talk. We have the drama part of the story, but we have also always the shining dark of the story. The shining with Bashir, I am working with each other since he's out of jail. Bashir is amazing. He's so cooperative. He's optimistic. He's looking for the future. And really, Bashir will stay here in Gaza, in Palestine, until suffering is disappear. سوف نبقى هنا حتى يزول الألم. Again, we are the stone of the valley, and we will not leave this part of our country because we are the owner of that country. We are the owner of the Al-Aqsa Mosque. We are the owner of Al-Qiyama. We are the owner of the West Bank. We are the owner of Palestine. We will stay here because this is our right. And everyone, he has to remember that one time these people, they will ask us to forgive them from revenge. Inshallah, this day will come soon as soon. Inshallah, I saw that in my dreams. Inshallah, it will be actually as soon as possible.
Okay, I have a question for you, Dr. Ahmed, and for Bashir.
Yes.
ليش انتم مصرين؟ Are you stronger than me مثلا? Are you stronger than Karama or Dania or Dr. Sweet? ليش? Why are you the people of Gaza still there? Why you refuse to leave? ليش انت يعني
ليش اهل غزة
انت مش خايف على حالك مثلا؟ انت مش خايف على اولادك؟ ليش انتم مش خايفين مثلا؟ او انتم خايفين بس انه you have no other option، او لانه انتم you are not doing anything wrong so you don't give anyone the permission to kick you out or something. احكي لنا.
احنا مش راضيين نطلع انه احنا اول حاجه احنا اصحاب الارض، يعني ما حدش بيقدر يعني.
Number one, we are not leaving because we are not doing anything
هذه
wrong. And this is our land. This is our home. Okay. Number two,
أرض
تفضل.
اجدادنا. نعم.
ليش الثاني؟
أرض أجدادنا هذه وتاريخنا الإسلامي على عريق وما بنقدر نستغنى، يعني ما فيش إنسان بيقدر يعني يطلع من بيته أو من أرضه ويجي واحد يطرده منها. يعني هذا بلدنا وأرضنا ومتجذرين فيها.
أبو أدم.
يعني احنا this is our land. This is our home. This is our roots. Our grandparents and grandparents, grandparents. We are not bothering anyone. We are not invading anyone. We are not stealing land from anyone. We are staying. We are just. This is our right to be in our homes, our land, and we don't give anyone the authority to remove us from here. تفضل. This is our heritage. This is our, our roots are there. ايش كمان؟
Dr. Nidal, this is the first one. The second one, you know this man. This man is Hashim Nazli. He's my grandmother. Okay.
He's your grandfather from the mother side.
Grandmother.
No.
جدي أبو والدتي.
Yeah, your grandfather from your mother side.
Yes.
Yeah, your English is like mine, and I'm get confused with these two.
I'll try to fix it. I'll try to fix
okay.
it.
Me and you. Yalla, we'll help each other. God help us.
Yes. This is Hashim
This is your
Nazli.
grandfather from your mother side. His Hashim is?
Hashim Nazli.
Hashim Nazli. And when was this picture taken?
He's from Yafa. Okay. He's the owner. Yeah. He's the owner of a home now, still up till now in Yafa. This home is 3 apartment, 3 طوابق, 3 floors. Okay. And it is one of the amazing house in Yafa Nuzha. Okay. I'm looking for myself to come back to my house. This is my house. My house is not in Gaza, in Yafa. Also, my grandfather used to be one of the ايش معنى تاجر بالانجليزي؟ تاجر ايش معنى تاجر يا دكتور نضال؟
تاجر.
Yes, he was a trader. He was used to give some sweets from Damascus to Yafa, like بقلاوة, like بلورية, like sweets. Yes, it is the eastern sweets. Okay, he used to import and export from Damascus among Yafa, and then export it to another areas of Palestine. So he was financially comfortable. He was dealing with Nablus, with Ramallah, with Hebron, with all the governorate of West Bank. So again, we are looking to because he owns the home, he owns his trade, he's owns the land in Yafa. We have to come back to our land because Palestine belongs to us, and as my grandmother told me, that they were the Jewish and the Christian, all of them were neighbors, and they were good neighbors for them, near Muslims, and they live with each other, because again and again we are not against Jews, we are against Zionists, we are not
دكتور أحمد
against Jewish.
دكتور أحمد أمك اسمها إيش؟ أم إيش؟ الحجة؟
انت شفتها بتكون
شفتها
بنته للحج.
يا ما هو ام ايش اسمها امك اخوه الكبير شو
جهاد،
اسمه؟
جهاد،
So
جهاد.
yeah, his mother M Jihad, we met her in Egypt. So can you imagine M Jihad, who's been living in Gaza for decades? Her father is from Jaffa. He had a three-story building, still exists in Jaffa. He and her were forced out of their land and pushed into Gaza, and they did not even leave it there. They have been attacking Gaza every few years since then. They have been putting Gaza under siege, and in the last 2+ years, committing a whole genocide, a campaign of ethnic cleansing, elimination against the whole people in Gaza, who their house is still there. Their house, the 3, 4 buildings, still there in Jaffa. Her family was a very well, doing family. They were working into, restaurants and suites, and they were providing for the other cities around them. So that elderly lady, I'm sure maybe after they left, they thought they will go back in a few weeks or a few years. This means that she's in her 80s now. She's in a frail condition. She's sick, and I'm sure her dream has always been that one day she will go back to the house
Dr. Nadal,
that
she
she was
visited,
born that she was born in Jaffa. تفضل.
we visited with my mother, we visited Jaffa nearly in 1986, before the first Intifada, and she went to her house, and she was shocked about that some strangers are inside the house. Some strangers are inside the house. She couldn't even stand. We support her. She was crying, and even the strangers who are inside that home, they noticed that something strange go at that time, and they ask what you are doing here. My father is talking Hebrew in good accent. He told them, this woman is belongs for this house is belongs for that woman, and she's in a very critical condition while she sees someone inside her house. What I remember from that,
when was that؟ امتى هذا السنة؟ What year was that?
هذا 1986. هذا كان عمري تقريبا حوالي 16 سنة في ال
So
1986.
in 1986, when Dr. Ahmed was only 16 years old, his mother and his father got the opportunity to go back to Jaffa and visit her house. And his father does speak some Hebrew, and they found that the house being inhabited by new Israeli families who stole the house, as they stole the rest of Palestine. And when he told them that this house belongs to this lady, this is my wife, and that's her family and her father's house. تفضل. وايش كمان صار بعديها؟
Rotary. I think at that time one of these strangers could understand the situation, and he asked all the strangers inside the house to get inside and to close the door, because he know if something happened, maybe there is fighting will happen. At that time, my mother told me about a will or something like will and testament for us, for all of her son and daughter, that I couldn't to come back or to live in my house. My advice to you: in one day you can by any way, by revenge, but any way to come back to that house and to get your our house again and again. So we'll never forget our mother what talking about, and what she was advised us about it.
So his mother, who does have the ownership of the house, she wrote a will for her, children, that this house belongs to them, and she wants them one day to go back and to claim her house and their house again. إن شاء الله one day. ريان، عندك ريان؟
ريان كان موجود بس غادر.
والله راحت علي، هذا صاحبي لازم أسلم عليه كل مرة، راحت علي اليوم.
الأستاذ بشير بستأذنكم، تم استدعائه الآن في حالة shift a case for the one of the field hospital. Again, like we said with Mukhallad, Bashir, inshallah, he's amazing. He's not feeling despair at all. He's have positive energy inshallah. احنا نحب الحياة، نحن نحب الحياة. We respect life, and we are again and again, we are a human being, deserve actual life that belongs to health and education and the traveling and everything. Goodbye for everyone. You want to leave عشان
في بس ملاحظة من الأطباء اللي معنا، في دكتورة اسمها ريم أبو صباح عم تحكي ل ايش اسمك عفوا؟
بشير.
بشير عم تحكي لبشير، سوري بشير أنا كنت مع الكول رايحة جاي، عم تحكي لك يا بشير إنه العلاج الطبيعي بيقدر يساعد بالنيوروباثي اللي عم بيصير، وخصوصا عملته عم يساعدك.
عملت علاج طبيعي على اساس انه انا اعمل تحفيز لعضله الايد. عملت
أيوة.
عملت علاج طبيعي، بس في عملت كمان صوره لايدي، حكوا لي انه في عندك تهتك في الاوتار. قالوا لي يعني اللي هم لما عملوا هن عمليتين مش عمليه.
أوكي.
عمليه هان
أيوة.
وعمليه هان. فهذا الجرح مش سطحي، وكان جرح غميق، وصاروا يحطوا فيه اللي هو نظام فتايل جوا. واللي زاد الجرح سوء الاهمال الطبي، يعني كانش فيه اللي هو تعقيم. كنت اقعد بالاسبوع بالعشر ايام ممنوع، يعني ما حدش يعني يجي يلف ايدي مثلا دريسنج علاج تمام غيرات. بقيت لما انا اطلع من زنزانتي او من سجني للمكان المستوصف او المكان الطبي اللي بخص في الجيش انه انا اروح اتعالج فيه، اثناء ما انا بروح مكلبشات رجلي، وايدي هذه المصابه كمان مكلبشه من ورا زي هيك، عيني مغميات، وواحد مسكني من رقبتي وبجر فيي. طبعا وانا رايح باكل كتل وضرب، وانا مروح نفس القصه، وبقعد بالسبع ساعات او 8 ساعات موجود عندهم على الباب، لما يصلني الدور اقدر اخش على الطبيب ويشوف ايدي. طبعا في اثناء ما انا رايح وجاي ما لا بضل نفسيه ولا بضل اساسا صحه للبني ادم يتشافى من هيك شغله. الضرب ما كانش ضرب انه مثلا لمجرد انه بده ياخذ منك يعني شغله معينه. الضرب كان الغرض منه ازهاق الروح فقط، او يحدث معك اللي هو اصابات او ندبات دائمه على مدار حياتك تضلك تعاني منها.
He's saying that he tried physical therapy, but the kinds of surgery that he had were very complicated, and he also had superimposed infections because medical care was very poor and continues to be poor. And he recalls that the way he was hit was so severe, it almost felt like what they wanted to do is kill him, not just beat him, but it was beatings with the goal of basically taking his life away. بشير سلامتك، وزي ما حكى دكتور أحمد انت عندك طاقة إيجابية. إذا بدك أي إشي خلينا إحنا على التواصل، بركي قدرنا نعطيك نصائح طبية قد ما نقدر. الدكتور أحمد بيقدر يشبكنا، ممكن جابا بنتون يساعد دكتور أحمد إذا موجود عندكم،
والله I
أو
tried to
ليريكا.
confirm دكتور ولد حسين انت
انا شفت قالوا لي انه في عندك مشكله في الاوتار. مشكله عندك في الاوتار، يبدو انه هم لما هم عملوا عمليه في شيء خربوه جوا، في شيء قطعوه جوا.
Just to
انا
remind everyone.
في البرد انا في مشكله، بحس ماس في ايدي، يعني انا في الوقت السقعه اللي برا هيك بحس وانا ماشي في ماس في ايده كلها بصير
I think
ماس كهرب.
دكتورة كرامة that he has some problem in the tendon and the neuropathic also.
Agree.
The neuropathy with tendonitis. So I think we need orthopedic consultation.
نعم.
بأي سجن أنت كنت؟ بأي سجن أخذوك؟
كنت في سيدي
Can I say something?
Okay, so Bashir, just a reminder, guys. Bashir was at C. Damon. What do they call it? شو اسم السجن كمان مرة بشير؟
سيدي تيمان.
Yeah, Sidi Timan. This is a very notorious prison. Just a reminder that those who are doing medical care, providing medical care there, are not real doctors, not qualified doctors. They were experimenting on those people and torturing them. So most probably whatever intervention he had was not done right, because the medical care is horrible and those doctors were not trained. And now in Gaza again, because of the attack on the healthcare, I'm sure he doesn't have access to full proper care. Karama, you mentioned gabapentin. I've been trying to look for one small, like 10 pills of gabapentin in Gaza for the last 2 weeks. There are so many medications that they're very hard. When it comes to pain medication, neuropathic medication, very hard to find in Gaza. And actually one, if you remember Musab Abu Taha, his grandmother, a terminal patient with cancer in Gaza, who's suffering some severe pain. We have been trying to find a pill to help with her pain because she's terminal case of cancer. We haven't been trying to find anything in the last 3-4 weeks. The only thing Dr. Izzuddin was managed to find like few pills of gabapentin the other day. So it's the people that are going through catastrophic situations, even the things that usually help or can give some partial help are not available. So then, Dr. Sui, you have your hands up. You want to
Yeah,
comment?
I tell you what, I'm listening to Bashir's problem. He has his hand tied so that it's almost went gangrenous. So the scars on the back of his hand is to release the pressure. But what happened is that when you tie the hand, the median nerve in front is also strangulated. Okay? So when you have a median nerve that's strangulated and not released, you have a chronic carpal tunnel syndrome. And it produces weakness as well as loss of sensation. That's why he's neuropathic pain. It could be that. If that's the case, then it is not incurable. You can do something about it. But somebody have to look at his hand and see whether it is a carpal tunnel. I think Dr. Isadin should be able to do that.
Maybe he need nerve conduction velocity to confirm
Yeah,
that.
I don't know whether you have it there or not. I think on the machines might be broken, but I think a simple examination to see whether he has got numbness of the thumb, index, middle finger, more than the little finger. Do it now. Ask him that whether the sensation is the same on the little finger and the index finger.
في الايد كلها في الايد كلها بصير.
كلها ولا في الاصبع.
لا في الايد كلها بصير هذا الان.
all the hand, not just the thumb and middle finger.
So in that case, both nerves are involved. The median nerve as well as the ulnar nerve, because the ulnar nerve goes to the little finger and half the ring finger. Median nerve is thumb, index, middle finger. Because it's tied so tightly, so the nerve are strangled. So if that's the case, I think you got to check it. If you got a nerve conduction EMG, that'd be very good to confirm the diagnosis. And then simple release. Okay, release the median nerve and the ulnar nerve, and it will get rid of some of the pain.
أنا عملت صورة وحكون إنه في عندك تهتك في الأوتار. الصورة اللي عملتها مش تخطيط.
Inshallah, tomorrow I try to consult orthopedic doctor and
Yes, please. It
neurological
might be
doctor,
yeah.
and I will do for him nerve conduction velocity. We
Yeah,
have
if you can,
one-
if it's available,
yes,
that would be
we
very
have
helpful.
system. It is available.
Okay, alhamdulillah. Okay.
Alhamdulillah.
So at least we know what's wrong. Okay.
Okay. We will get the permission, Dr. Karama, because Bashir want to go to his job because he will shift the case.
يا شكرا يا بشير، شكرا.
حياك
Okay.
الله.
عطلناك احنا. يعطيك
لا
العافية.
حياك الله.
مع السلامة، دير بالك على حالك.
الله يسلمك. حياك الله.
Thank you.
Goodbye.
Thank
مع
you, Bashir.
السلامة.
Salamtik.
السلام عليكم.
وعليكم السلام.
دكتور حياك الله. السلام عليكم. السلام عليكم. لا مش قادر بطلع عشان بتصل.
داني ألف سلام عليك. You have common cold. You need ginger. You know, fresh ginger is good.
Yeah, thank you. شكرا.
Maribeth, how are you?
Very bad has graduation coming.
Oh,
28 April is my graduation.
Yeah, I know.
we are invited.
You
Yes.
absolutely are. You can come try and crash it with Dr. Nadal because again, I'm limited in tickets, but he is showing up anyway, he says. And can I say a very dear friend is also planning to crash it as well. I don't know if she wanted to tell people that Tanya is also planning to crash graduation. So Karama has a ticket because she will be doing my hooding to make me a real grown-up doctor. And
It's my pride and honor.
and Nidal and Danya will be taking turns sitting on each other's shoulders to look in a window and bang and say, hey, in there, I see you. Maybe. We'll see. But I'm doing great. Alhamdulillah. Yes.
Yeah.
We are all proud of you, Maribeth, and really I'm following your story. You are doing a great job about the Palestinian, about the what we are suffering, about the doctors, about doctors against genocide. Thank you for sharing that story every time, every day, because you are really talking among the West population, and we need that to be more popular, to talk about the Palestinian and what they are suffering against. Thank you again.
Thank you. I would love to get to Gaza before residency starts in June. I'm working on it. Like my Irish mom would say, from your lips to God's ears.
Yeah.
Just trying to create it, speak it into existence. So maybe, inshallah, I can come see you.
Inshallah, after graduation, we hope that you will join Gaza to work in Gaza, inshallah.
Yeah, I think working in Gaza for even a short period of time and then bringing that back to share those lessons with my fellow residents in growing more doctors against genocide, that being a doctor against genocide just becomes the culture, the expectation.
Fantastic.
Yes.
Dr. Ahmed, I wanted to ask you, you were talking about the papers, the research papers and the abstracts. I did not understand what you meant by saying, you said something about medical students and college, and what did you mean by that?
I mean about the conclusion or what?
Not the conclusion. You said something, you felt you were at the university in Cairo, or
Yes. What
He's
I
talking about
mean,
standard.
this is a research that it used to be for the student, like for example, Mary Beth, who want to graduate from her faculty of medicine, okay?
Yeah.
But the grade on or the level that was discussing among that research was really more valuable, that you think that he's a graduated doctor and he's preparing for master degree or something more than master degree.
So you were
That
very pleased with the level of
yes,
knowledge.
yes. I was surprised because they nearly expend nearly 3 years in the war,
During
and
genocide.
they were at the tent, and they are still following and still updating their data. They are in contact with a lot of medical magazines like Lancet, like a lot of magazine. They are following a lot of professors outside. They are taking some advice from them. Really, I was surprised about the level that they are talking about.
Amazing. That's really, 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 really encouraging to hear. And I am not surprised because everyone that we worked with in Gaza has been exceptional with data collection, with the research studies, with the level of professionalism is really impressive despite everything. يعني شبه معجزة الصراحة.
Yes. دكتور،
Miraculous.
وين قريبة الدكتورة عدلة؟
ما كانت تون وطلعت عدلة، حكت بالأول أنت جاي متأخر، بدك قريبتك تيجي على الوقت، مش تيجي لآخر 10 دقائق. وأنا راحت علي، أنا صاحبي راح علي، ما حكيتش مع صاحبي ريان لأنه
عم
برضه
يسأل عن قريبته بده قريبته.
عدلة قرايب دار الفرة هدول.
والله انت عندك سبوت دايجنوزز.
اسمع،
قريبتي
سلم لي على
الدكتورة
ريان،
عدلة.
احكي له، سلم على ريان واحكي له المره الجايه ممنوع اروح قبل ما اسلم، لازم اول ما تيجي انت نسلم على ريان بالاول ونحكي معاه مع بعض، وبعدين هذا بده يروح.
ابشر 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 ان شاء
محمد شو
الله.
اخباره محمد؟
محمد والله يعني غاطس شوية كده، عم يشتغل شغل كده عن بعد وكده، ربنا يوفقه ان شاء الله.
ممتاز، على فكره خليه يحكي معنا، لانه بلشنا احنا نساعد بمجموعه من هذول الناس بيشتغلوا فريلانسرز وعن بعد، فبلكن ساعدناهم في غزه. هذلاك انتم بخان يونس
هو في خان يونس.
maybe we can help with the same thing in Khan Yunis too. Nice.
احنا يعني دعائنا وصلواتنا لوالدة الدكتور أشرف أبو العز إن شاء الله. إن شاء الله ربنا يشفيها يا رب العالمين. هي في كندا.
امين يا رب. يا هي في كندا والله يا.
إن شاء الله أنا هتواصل معاه إن شاء الله ربنا يشفيها يا رب شفاء لا يغادر سقما.
اذا ممكن بلكن عملنا ميتنج مع هيك زوم على السريع، انا وانت وكرامه وكم واحد مع دكتور
إن
اشرف.
شاء الله we have to support him. دكتور أشرف والله يعني قامة كبيرة وإحنا نعتز به كما نعتز بكل أخ وأخت من المجموعة.
الدكتور اشرف مثل غزه، بنحكي له احنا الدكتور اشرف نواره، وغزه نواره، عن جد اشرف نواره بجد.
هو له وقع كبير، وعلى فكرة الدكتور أشرف اللي بيقترب منه كتير يعني بحس إنه صعب الاستغناء عنه.
We know this feeling.
Yes.
He keeps the spirit of everyone up, ما شاء الله. Despite all the difficulties, he's always positive, and يعني I really think he felt like in Gaza, he felt like it's the best place in the world. I mean,
yes,
he felt like really home, that he belongs there more than anywhere else. على فكرة, when they did not allow them to leave, he was not mad. He was happy that they are keeping him an extra week or two. The only thing is because his mother got sick and his family got worried. But if it's up to him, he would rather stay there, not leave. I think we all share this feeling. We wish we can go and stay there.
إن شاء الله. إحنا أخذنا وعد من الدكتورة دانيا والدكتورة ماري بيث والدكتورة كرامة، وإن شاء الله الدكتورة إيمان والدكتورة سوي. إن شاء الله we are inviting you to visit Gaza إن شاء الله.
إن انت بدك تاخذ كل الستات وتخلونا احنا لحالنا احنا برا، بدك تاخذ كل الستات العالم تحطهم في غزه، بعدين معك اياها الغزه. طب انا واشرف وين نضل؟ وين انا واشرف ومارك نضل مرميين هون يعني؟ ولا مرة حكينا تعال
عجبك
على
هيك يا
غزة.
دكتورة كرام؟
Yeah. على فكرة it's good that we are able to bring a laugh here and there despite all what's happening.
والله
Yes.
لما يكون دكتور أحمد خلص كل
Yeah.
المود بتحسن.
ما هو محمود درويش على فكرة غزة is أكبر مثال على الكلام كان دائما محمود درويش يحكيه، نحب الحياة إذا ما استطعنا إليها سبيلا، وعلى هذه الأرض ما يستحق الحياة. ف we always try to live and crack a joke and have a smile despite everything. That is an act of resistance, an act of survival. And I really think the main thing why people in Gaza are still standing and still trying to excel in everything is because they love life more than anything else and more than anyone else. That's why it's hard for anyone to break them. And just the love of life, and the love of achievement, the ambition, what keeps them going, what keeps giving them hope. Like I myself, if I was in Gaza, I will not be like Dr. Ahmed. I will be depressed. I will be broken. I will not be able to do anything. I don't want to see anyone or go on any webinar or communicate with anyone in the world. But because Dr. Ahmed and his colleagues and the people of Gaza are different, that's why that despite it all, they refuse to disappear. They refuse to be silenced. They refuse to be erased, and they refuse to be expelled or ethnically cleansed. So we owe you, Dr. Ahmed, and your colleagues for keeping this spirit and keeping us inspired by your example. And we are really learning from you every day. انت
We
دائما
are
بتحكي
taking
انه انت بتعطينا معنويات، مع انه العكس، انت اللي بتعطينا معنويات، مش not the other way around.
والله والله again and again after this webinar we are more strong and we are more believing and we more able to continue and in high and steady and constant way. We will never stop inshallah. Dr. Nidal, I want to mention that the depression nowadays in Gaza is not present. Really, I saw a lot of psychiatric doctors. They told me that before the war, there is a lot of cases of suicidal attack. If you remember, some guys tried to burn themselves. You remember that period in Gaza before the war? Nowadays, yes, nowadays this is ended, alhamdulillah. We didn't hear about that because now I think this is from God. This is from our believing of our right. This our believing that we have to have the victory in this struggle and we have to win, inshallah, Rabbil Alameen, as our God promised us again and again. So inshallah we'll see you in next webinar, inshallah Rabbil Alameen. Thank you. Sorry for being late because Bashir was in duty and he was in the Red Cross hospital and I'm waited for him to be joined with us. Inshallah next week another one of the health workers who were in the prison. I want to listen for what's happening for them because we have to remember them and we have to talk about what is they are suffering from, and we have to sometimes to close our eyes and to try to imagine that this is happening لا قدر الله with each one. Okay, thank you.
Well, thank you, Dr. Ahmed. You don't need to apologize, but I think we are kind of making a habit now. Like the second half of the webinar is for you, so take your time. By the time you join, we are done with all our guests, and we'll give you that last part, the last piece. مثل ما
خلاص.
بيحكوا التالي للغالي، فبراحتك. It's okay.
Always
Join
happy to
whenever
be
you
here.
time, and actually it all works good. So we start with our regular guests, By the time you join, we're done, and we'll give you all the space for you.
Social
and
hour.
social hour. Actually, it's
The
paid for
social
hour.
hour.
It's paid
No,
for hour
remember, we
too.
call it Baba time. They get to
Baba
just
time.
sit and
Very bad.
No,
As
but
in,
Very
are you
special.
have
are
their
you saying
chit chat,
are you
have their
saying that
Ahmed is
time.
me?
not Ahmed
Are
is
you
not
saying
old
that
enough
me?
to be our
Are
Baba.
you saying that me and Dr. Ahmed are old? شو قصدك يعني؟ أنا
Not at
كبير؟
all, but isn't this the blessed rite of passage? Like
شايف بالله.
I love getting older because now I can just sit and have
But if we
that
have no,
time
no, no.
together.
If we want to fight genocide, we have to be young and strong and unwavering. So me and Dr. Ahmed and Dr. Suyang actually are getting younger by the day
Optimistic,
because
Yes.
full of hope.
the fight is still young.
If the spirit is willing, the flesh will follow.
We have to be as young as the fight
I
is. As young as the
always.
fight is.
Yeah,
What do you think, Dr. Suyang?
exactly. You know, look
Yeah.
look at the people who were arrested yesterday. A lot of elderly retirees and so on. They say, you know, there's something we can do. We can speak up and upset the government. Okay, this is our form of resistance. Yeah.
Yep. Thank you. So thank you, everyone. Thank you for joining us. Don't forget, please, try to do everything you can wherever you are. You can do it locally, you can do it in your hospital, you can do it with your local officials, and even better, come join us April 15th on Wednesday. If you want to have more impact, if you want to join your colleagues to make the voice of the medical community, the moral part of the medical community more heard, please join us. You can be a doctor, you can be a nurse, you can be a colleague, you can be a patient, you can be a neighbor, you can be an accountant. Anyone who supports the mission, anyone who has a conscience, please join us. And if you want to meet Dr. Iman and Dr. Dania in person and see how they excel at work, how they can make things great and very well organized and very smooth, come in person, please. We are meeting
أنا
actually.
بستنى دكتور الفرح. دكتور
دكتور
فرح
فرح
أنت
NDC.
you signed
انت
up.
بتيجي.
أنت جاي يوم
Yeah,
الأربعاء.
Dr. Farah. أهلا وسهلا. Welcome
يوم
back.
الأربعاء أنا شفت اسمك في الليستة.
He's
هنستناك في
everywhere.
يونيون ستيشن الساعة 9.
إن شاء الله إن
إن
شاء
شاء
الله I'll be
الله.
there.
أوكي.
إن شاء الله I'll
Outside
be there.
midnight. Yeah.
إن شاء الله.
Yeah.
I'll come back.
إن شاء
Yes.
الله.
Always.
Next time,
Always.
yeah, he will be with us in spirit, and next time, inshallah, he will join us. And for all of us, next time in Gaza, next time in Palestine, next time in Jerusalem, our Jerusalem, not their Jerusalem. Please stay strong, keep up
Thank
the good
you.
work. Next time in Jerusalem, on our terms, our Jerusalem, it's not
Yes.
theirs.
Yeah.
Next time in Jerusalem, stay strong, keep the fight. Thank you, everyone. And
Thank you.
inshallah, we'll see you in DC and we'll see you next week. And Dr. Ahmed will be with us in spirit, and maybe
Please
we
take
can have a
some
video.
pictures. I
Yeah,
want to
we'll
see
have
all
a
the pictures.
video, and he's having. I told you we are young. We know these things
مش
too.
أنت قلت
I
لي
know
You know,
كده؟
we're going to take a lot of pictures.
exactly. This is the young people signs. I don't know how to do them, but I'm learning. Yes. Okay.
I take selfies.
Yalla, we love you guys. Stay strong. Allah yahmikum.
We
Yalla,
love
salam.
you too.
Bye
Yeah.
bye.
Bye bye.
Salam.
Bye bye. Shukran.